to call to order the meeting for January 10th, 2022. Could I ask everyone to rise for the Pledge of Allegiance? The flag is around the corner there, through the window. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
You get a roll call, please.
Mrs. Eisenberg?
Yeah.
Mr. Hefner?
Here.
Mr. Hohenschel?
Here.
Mrs. Hughes?
Here.
Mr. Reitnauer?
Here.
Mr. Sheets?
Here.
Mr. Stubitz?
Here.
Mrs. Walliser? Here. Mr. Wagner?
Here.
9 present.
All right, moving on to recognitions.
So this evening we have one recognition. We actually were supposed to have two. Mrs. Sharon Mutter, who is our secretary at the middle school, was to be recognized this evening. We're going to move her to February. Unfortunately, she wasn't able to attend this evening. So the one recognition we do have this evening, though, is for Mrs. Nicole Shellhammer. Nicole, I believe there she is. Paige, would you like to, or Nicole, would you like to? What? Nicole, if you can come up here. So just as we transition here, we do a New Heights Award every month, and it's 2 employees, and they become essentially like our Employee of the Month. And so we're excited to recognize Nicole. Nicole is new to the organization. Not too long ago, she joined our team here and has just been a wonderful addition to the team. The New Heights Awards are given out. Any student, any staff member can recognize someone for a New Heights Award. We collect all those names on a monthly basis, and usually we have about 20 to 30 individuals that are recognized, and then we choose 2 of those to be the top Employee of the Month. So congratulations, and I'll turn it over to Nicole to share some accolades.
Yeah, so good evening, everybody. So I'm just going to read kind of what was submitted. Nicole Shellhammer is the newest member of our business office team. We recommend her to receive the New Heights Award for her professionalism, positivity, and enthusiastic school spirit she shares with everyone each day. Under the mask, Nicole is always smiling. She continues to maintain a high level of enthusiasm as she learns the intricacies of the office functions and her new role. She greets people with a kind, helpful manner and boosts morale with her resourceful and energetic nature. She's a wonderful asset to the Brandywine Heights business office and reaches new heights every day. So basically everything that's said about Nicole is absolutely true to the T. She certainly embraced her responsibilities with enthusiasm. I'd say that's an understatement for anybody who's ever met her. She definitely has that contagious personality. She's obviously committed to learning the nuances of her role. I think before she came on board, she worked in the private sector. I think school business is kind of, a new twist in anybody's working environment. So she's definitely embraced that. I would say she brings a lightness and a fun to our office that has been missing. I'll say the one thing she does best is she definitely has that energetic personality, but she can kind of read the room. If it's a tough day and everybody's pretty quiet, and she'll find a way to lighten the mood. But also she can see, now's not the time kind of thing. She'll also be that person that, hey, can I help you with something? Or hey, like she reads people well. And that's something that we definitely need. So she's always a resource to all of us. Some people call her, and I don't know if you know this, they call her the hype girl in our office. And she always finds, whether it's a spirit day, as you can see by she loves her patterns. Apparently this is at home as well. So she always finds a day to dress up. Most recently she was the Whoville girl. I don't know if people are familiar with the Grinch. And she had a phenomenal hairdo for Christmas. But I mean, whether you're in our office or whether you're in the building, people just stop by and say hello and just get a few minutes. But she's always willing to help, and definitely is a great personality in addition to our team. So, yeah.
Congratulations, Nicole.
Thank you.
Absolutely. So we can give you a little stick here. And I thank you so much for everything you've done for the office, for joining this team. I know it's a little bit of a leap of faith, if you will, taking a new role and coming into the school environment, but we're so thankful that you come. as Nicole said, it has changed the environment, and you have such a positive thing happening. So keep it up.
Thank you, I'm happy to be here.
Absolutely. Congratulations.
Thank you.
So next on the agenda is our student board representative report. We're going to skip that this evening. The two high school students are not able to attend because of COVID-related absences, and Miss Stout, who is our intermediate middle school representative, is at a basketball game. So we don't have any students to report, so we'll skip that and push that off until February. Next up, January is an opportunity for school boards across Pennsylvania to be recognized. It's officially School Board Recognition Month, and so as our 9 elected officials, we value what you do. You are our guiding light. You're the ones that set the policy. You're the ones that set the direction for the school district. Us as an administrative team, as a staff, teachers, all our support staff, and most importantly, our students, all fall under your responsibility. You have a tremendous responsibility. You are elected officials representing the community. And again, like I said, most importantly, representing the education of our students. So I thank you for that. And in doing that, we try to make a special recognition for you. And this year, the intermediate middle school, under the leadership of Mr. Farina, put together a short student video for you to highlight. Thank you. So we're going to turn it over to video. So thank you for all you do. I greatly appreciate it. It's a cute little video, a lot of student clips. I love it in the beginning where it shows the empty space and lights hanging to where we are now. And again, that's just one layer of what you do, but you have created that. You created that by looking at projects, by looking at the finances, by approving those things, and by creating these new educational spaces for our students. So thank you for all you do. I know it is a lot of extra work on top of your busy lives with your families and the school districts, but it is an important piece. So what I'd like to do now is transition. We have a presentation before we get actually into the meeting agenda, and that is a presentation from our auditors. And I'm going to turn it over to Ms. Del Guerrico. on an annual basis, we have an auditing firm that we partner with, and they go through our audit book, they go through all our records, and spend time in the summer and spend time in the fall with us to make sure that we have clean books and that we are doing everything according to the standards for accounting purposes. And so this year, we'd like to recognize that and talk about our auditing, especially since Ms. Del Puerco is our new business manager. We thought it was very prudent for us to bring the auditor in and just do that check and balance to make sure that we are on the right track. So, Nicole, I'll turn it over to you.
Yeah, so good evening. This evening I'm gonna have Mr. Bo Travis from Gorman and Associates, he's our auditing firm, speak to you guys for just about 5 minutes. Quick high-level overview about how the audit went. Our fiscal year ends June 30th, so they'll come in normally around kind of toward the end of the year, kind of just check in, check some things, and then they'll do the full audit, normally around in August. And then between now and then, we'll kind of, fine tune some things, clean things up, do some final entries, so that the audit is done, normally by December. So I'm gonna have Bo come up. And I'm gonna give you guys a copy of the full financial statements. They are linked to the agenda, so if you want hard copy.
Thanks, Ed. I'm just gonna give a real quick summary, high overview of it. In your financial statements that you receive, I'm just gonna go through the table of contents and point out some things that you might want to take a look at when you're going through it. The first is the letter to governance and management. That's on pages 2 through 5. That's kind of our letter to you guys saying, hey, this is what we did, this is what we looked at. If we've identified any control deficiencies, significant material misstatements, they would be in that letter. And before we didn't have any significant deficiencies, so that's excellent. We also put in recommendations that we have and then some other things that may be coming up for new standards down the pipe in that letter. So definitely read that letter and give that a look. Then we get into the financial section, the independent auditor's report. So this is our report opining on your financial statements. And it's pretty much us saying, are these financial statements presented fairly in all material respects? And did we find any issues that we think maybe are misleading, or could somebody that's reading this financial statements taken out of context of the financial position? And our opinion is unmodified, meaning it's a clean opinion. We don't have any issues with it. We believe that the statements are clear and concise and that they're performed and they're accurate. You get into the basic financial statements, and that's what we are opining upon. That's from pages 22 to 35. Those are your high-level financial statements. You have your district-wide financial statements and then your fund financial statements. The difference between the two is one is based off of modified accrual. That's your fund financial statements. And those are kind of like your daily operations, your modified accrual basis. Okay? And those are the ones that are, you would budget towards, and the financials that you look at. Now, the district-wide financial statements are with full accrual, and that's just pretty much, basically, it's your long-term assets and the long-term liabilities are added. And the major things there are pension and OPEB and capital assets. Then you're in the required supplemental information. Those are detailed schedules of your pension and OPEB liabilities. That's all required to be reported your total audit package, and those notes to those. You get into the supplemental information, and that is more fund-specific financials. So each fund, so your capital reserve fund, more detailed breakdown. Because on the basic financials, it's more of a high level, not just function line, it's like literally instructional support, operational. So those back schedules are actually more of a detail, and we audit those as well, so those numbers are good. And then we get into the single audit section. In the single audit section, not only do we have to opine on the financial statements presented fairly, but we have to also, the school district is required to follow government auditing standards, which we have to test your internal controls on financial reporting. So how are those controls working? How are they doing to make the financial statements accurate? And I'm glad to announce that we didn't have any findings, so those are good. In addition to that, we also have to opine under because your school district spends more than $750,000 in federal expenditures, you're required to have a single audit done and fall under uniform guidance. The OMB, the Office of Management and Budget, has compliance. So we gotta test compliance issues or compliance on certain federal grants. This year, we tested the child nutrition grant, the National School Lunch Program. That one came up that we were required to test, and we didn't have any material misstatements, no findings in compliance, and everything, the program is working how it's supposed to work. So that's all good news. I think it's exceptional that you did. I mean, for the turnovers that you had in the business office and stuff, you know, we were a little bit concerned when we did our pre-audit procedures on what kind of issues we were going to have. We were a little bit nervous, especially with the lack of people in the business office, but I think controls are in set and in place and actually turned out really well. I think that they did a really great job, and Nicole coming in, stepping in, it was an excellent one. Any questions?
Thank you, Bo, for that summary. Thanks for coming out tonight. I appreciate you recognizing the business office and the controls in place, because if I think about it, there's essentially two, depending on how you look at it, three people that stayed through the course of the year with all the different changes and everything else. So,
And I forgot to mention you, sir.
no, that's not me. It's there.
You actually stepped in when there was that break, and we've had a lot of communication back and forth. And I do recommend it's really great about your district is to make sure they're not getting in trouble all the time. They're emailing us, hey, can we do this? Can we do that? Is it okay? And that's good, because it sucks when we come out and, you know, we thought, oh, that should be fine. You don't check, and then we end up writing everything up, and you're not following the rules and regulations, and problems can happen. But it's good that you have that good communication, and you guys are always checking up. And we like those questions. We'd much rather you ask us the questions so you do things properly and do things correct.
And I thank you for that, because it's good to have that partnership that we can ask those questions. And I'd rather just do it right from the beginning, like you mentioned. And while it was fun to play business manager for 6 months, I don't want to do it again. It's all yours. Any other questions?
Steve, great job, Nicole. Please pass on to Beth Ann our thanks as well for keeping the wheels on, and great job just picking up the baton and running with it. So thank you so much.
Thank you. Thank you, Beth.
Thank you guys.
Thank you for your time this evening.
Alrighty, moving on here. Time for public comment, anything relative to agenda items. Is there anyone that would like to address the board? Yes, if you can just state your name.
My name is Danielle Zelko. I'm new to the district.
Okay.
Can you hear me?
Yeah, we're good. Thank you.
Okay. So I'm from Fleetwood. This is not how Fleetwood does things. So I just need a little bit of direction.
So the way public comment works is we just ask for your name, where you live, and then you can provide any comment relative to any agenda items, so the board understands the community's perspective. Once we hear all the public comment, we'll actually start to disperse and go through the regular agenda items. There's 4 sections, and we'll go through those sections one by one. The board will deliberate, discuss those, vote on those items, but we ask for the public comment for any agenda items ahead of time. So if you have comment relative to anything that would be considered by the board this evening, this is the time to make a statement about that.
Okay, understood. So again, and I apologize, I'm used to like a 3-minute time limit.
Yeah, there is. There's
Okay.
a. Sorry, I guess we should.
No, that's okay.
I thought you were asking more specifically about, or in general, what that process is. I'm sorry.
No, that's okay. And if you don't mind, I do better standing up.
Yes, please.
Okay,
Please.
super. Thank you. Okay, great. Hi, everybody. So in my normal job, I am a safety director for a food company. I've been dealing with COVID, obviously, like everybody else has, for the last 2 years. And I know that there is a very wide gap range of opinions, perspectives, you know, personal experiences and stuff of that nature. Okay, so I come here assertive. It's my personality, but by no means am I personally attacking. Although some of the comments might come off to where you're offended. Okay, so, but again, Danielle Zelko, I have a senior and I have a third grader. I'm welcome to conversation. Obviously, maybe not tonight, but look me up, give me a phone call, we can talk. Okay, here's my spiel. So, we were at Fleetwood our whole life pretty much, and my girls did Ingenuity Virtual, and we chose to do that because of the mask mandate. It's not because we live in fear. We haven't worn a mask for 2 years. We won't do the COVID shot, at least not now. To me, there's not enough data. I'm certainly not going to put something in my child when the entire 2 years has been up and down, back and forth, no straightforward data. People are living, people are dying, people are contracting COVID with the vax, without the vax. Quite frankly, in my opinion, the government doesn't know what they're doing at this point in time. And I'm not about to subject my body or my child's body to a vaccine, period. I'm blessed with children. It's my responsibility to make decisions and provide for them. Agencies, schools, people, media, medical doctors, you can all give me guidance. That's super duper, and I will listen. I will be objective. I will ponder it, but I have a brain and I will use it. I'm not going to fall in line and be a little soldier how the government wants us to do it. It's not going to happen. We live in America. We have freedom. I have God who brought me into this world and who will take me out when he is ready. COVID's nasty. It's real. It has killed people. There is no doubt about that. But it is a virus. It mutates. It lessens. And thank God we're starting to get therapeutics and we're starting to have truth and honesty. And hopefully people have real conversations instead of the agenda that's going on behind the scenes. Now, I understand that it depends on what news source you listen to. You can listen to CNN, MSNBC, Fox News, Dr. Fauci, Dr. Malone, Dr. Peter McCullough. You can look at all the different scientific papers. I'm not that smart. I can read it, I can understand it, but at the end of the day, these are my kids. So as I said, I am a safety professional. I have listened, I have read, I have, for hours. I've read the CDC documents, the entire website, if you can navigate through all of it. I read the Department of Labor documentation. Has anybody else read the Department of Labor documentation? The one where they want to segregate vaxxed people and unvaxxed people? Anybody else read that 48-page document?
That was the 3 minute, you wanna?
May I continue?
3 minutes that's how we have set up on the agenda, so if you just wanna make a closing statement, that would.
Thank you. I do appreciate that. Thank you very much. All right, so here is my closing statement. I'm going to end with just the masks. So I told you I do safety for a living. Okay, part of my job is to make sure that when people go to confined space, they have enough oxygen in confined space. Because if there's not enough oxygen in confined space, what happens? Oxygen depletion, you die. So there's a lovely air monitor, and I'm sure you've seen this on YouTube. I did this to my child, to my third grader. I put a mask on her. I looped it up how the CDC wants it. I pinched her nose. I made sure it was no air. Did I do this or did I not do this? I put the wand up the mask, and the alarm went off, telling me that she doesn't have enough oxygen. Here's where I'm personally attacking the people who are wearing this mask. Knock it off. Take off the mask. You are suffocating your child. You're suffocating them. That's oxygen depletion. Super great that you think you can all breathe, but you're not doing that to my child. No offense, all of you have touched your mask at least once since I sat there. So if you think you are protecting yourself from germs, that's lunacy. Stop the masks. Stop this contact tracing. Who cares if you get sick? So we have therapeutics. Wash your hands, get some rest, drink plenty of fluids, get over it. But this is ridiculous. People are in fear. They don't want to take their masks off. They don't want to see people. They don't want to get within 3 feet of each other. And you are perpetuating this by wearing your mask. Your cute little masks that match your outfits. It's ridiculous. Take off your mask and smile. Depression, suicide, all this stuff, you're adding to it. I'm finished.
Thank you. Do you have any other public comment?
I would like to speak, but I'd also like to wait until after the new health and safety things have been presented. Because that might answer a bunch of my questions that I have. So I'd like to wait until after that's presented before I can speak. Is that okay?
That's fine.
Okay, thank you.
I will third that as well.
Me too.
Yeah, so the next public comment isn't until after that vote is taken. So if there's something you would like to say to address that, now would be the time.
So I would have to speak now before you vote on the new.
Correct. Yes, the only other time would be that at the end of the meeting for public comment.
Okay.
I'll give my
Okay.
2 cents. My name is Linda Pedersen. My son is a 9th grader. Good kid, he's in all your honors classes, straight A's.
It should come before the board, I paid your.
Yeah, ma'am, I'm sorry.
Can you speak up and move forward? Thank you.
Not a big talker.
No, that's okay. So, no.
Really, actually, I'm a very involved parent, but I don't generally speak up a lot. Anyway, my son is a 9th grader. He's in all your honors classes. He's getting straight A's. He's a good kid. That said, I am also a nurse. I have worked through COVID and the entire everything. What she says is true. It is a virus. It is going to mutate. The current vaccine does not allow for your body to fight off the mutations, and so there will continue to be more and more vaccines. My goal in what I'm saying is hope that you take all this into consideration with the new health and safety, whatever you're voting on, to realize that as a nurse, I see people who get COVID with masks, with vaccines. My staff got it wearing full PPE, full N95s, fit tested, the whole thing. It's a virus that will be around forever. And to continue to mask these children seems like such a detriment to both their social and physical well-being. That's my 2 cents.
Thank you.
Thank you.
So I kind of have to filter things out because I had some for what we were going to do here. So bottom line is, I'm not here to talk about masks.
Ma'am,
Whatever.
Just your name, please.
Oh, sorry.
That's okay.
Nicole Smith.
That's okay.
Fleetwood, Rockland Township, I don't know if you need.
Perfect.
All right. Anyway, my problem that is going to be presented tonight is regarding the segregation of the kids regarding the vaccinations. When I send my child to school, I don't expect them to be segregated for anything. We don't segregate the children if they're getting a free or reduced lunch for a person that's getting a full lunch. We don't do that. At least our children don't do that. Our parents don't do that. I don't know if the child next to me is getting a free lunch or not. Personally, I don't care. It's not my business. I don't know if the child sitting next to my child is fully vaccinated from all their childhood vaccinations that are required to be in school. I don't know if the child sitting next to mine has the flu shot. It's not my business. It's not my concern. Whether my child is vaccinated or not shouldn't be anybody's concern except for mine. I work at a hospital, and the amount of staff that is out right now is the highest it's ever been in the past 2 years. And guess what? 90% of our staff is vaccinated. Our staff is out due to COVID. So being vaccinated, you're going to have people that say it's better, it's not. I don't know. Nobody knows. If you really think about it. But being vaccinated should not make it a difference if a child has to quarantine or not. And when a child is pulled out of the classroom and says, okay, well, this child does not need to quarantine because they're vaccinated, but this one does, you're going to create bullying. Bottom line, it's going to happen. And I don't need my child to do that. These children have had not a single normal school day for 2 years, and then that is going to be on top of it. It is not fair to these children. Let them be children. Whether you do masks or not, I don't really care. Do I want my child to wear masks? Absolutely not. But if my child can stay in school because that is what you want to do, fine, so be it. I don't care. My child needs to be in school. That's where they need to learn. That is what the school is for. Not being at home where I have to pull out of work because she needs to quarantine to sit at her so she can do it on a computer. No, it's not acceptable. She needs to be in school. Both of my children need to be in school. I'm saying she because she was the one that had to quarantine. Whatever. Anyway. Another thing is, I don't know if the child sitting next, and this is getting very deep, but child sitting next to my child could be positive for HSV, which is herpes of the mouth. They could be positive for HIV. I don't know that, but we don't segregate that. You shouldn't be segregating that. Sorry.
You know, closing argument.
Yes. Basically, my bottom closing argument is these children should not be labeled to vaccinated, unvaccinated. And I don't care if the public is doing that because that's what it is doing. But it should not be in the school. It should not be so these children have to choose. I don't think that's acceptable at all. So that is my thing with the school. I don't care what you do with masks. Do I want them to wear a mask? No. But I do not want children to be segregated. Oh, you're vaccinated, you're not. Unacceptable. I do not agree with that whatsoever. So
they segregate them for wearing masks and not wearing masks. Because my child is told you need to sit 2 feet behind everybody because you don't wear a mask. I agree with her, is what I'm saying. The segregation has to stop.
I'm just, that is my plea to you guys, and I really hope you listen with this because I do not agree with the segregating between vaccinated and non. Thank you.
Thank you. Any other public comment? Clark?
Hi, my name is Erin Clark. I'm a little bit behind, so catching up. I only had like 5 minutes before the meeting was at a basketball game, so I didn't get to really read as much as I had wanted to, but I know that we were talking about the health and safety plan. So my understanding is that what will be presented tonight is we will be shying away from case counts in the buildings or as a whole. So like right now, the current health and safety plan states that if you have 5 cases in a building, then masks become mandatory for 14 days. So doing away with that would eliminate masks in general in every building. So we would no longer be monitoring that. So then my question to you is, we will still be following all the CDC guidelines, which would then increase all the contact tracing that we would have to do, correct? which
Yeah.
would then be sending kids home for 5 days, then worrying about whether who's vaccinated. I don't really want to go into all that, but that would be the current guidelines then.
So, yes. The
Okay,
one stipulation is there's two plans on the agenda tonight for consideration. The one is to keep consistent with the current plan,
okay,
which is the metric system, 5 cases over a 14-day period. The other plan is to eliminate that. That
okay.
way it gives the board some discussion points of which way they want to go.
Which would then, I guess, the option then is to test to stay. But what the option is, kids can test negative, and then be positive 3 days down the line.
That could happen.
Okay, all right. So then you could potentially be having kids stay in school that could be testing positive 3 days in the future, which then you're contact tracing back. So that seems like, I understand that this virus is not going anywhere, but the options to keep my kid in school is to send him and her every day, which I'm fine with. And then you have the virtual option, which is not a great option to me. So I'm just trying to figure out the balance of the constant in and out. Like, where does that factor in? Like, if I'm choosing to send them, I want them there. So how do you balance that continuously so that you're not constantly having kids virtual? I mean, just from my standpoint, my kid made it 1 day. He made it Tuesday. And then he was home for 5 days. So like at the current track, I mean, we're not off to a good start, which I get. I'm just trying to figure out, I don't want to discuss the science of the virus. I don't want to discuss math. I'm just trying to figure out what the best option is to keep kids in school. And I'm more worried, like, I'm not sure case counts matter or will make a difference, but what really, you can't get away from contact tracing. How are you going to keep kids in school?
Any other public comment? Hearing none, we'll move on to the agenda items. Can I get a motion and a second for the board of directors report?
So move Sheets.
Will I have discussion on these items then?
Yeah, we'll have, it's those items that were discussed are on the agenda for the health and safety plan, all those,
Yeah, we're gonna be able to discuss that. Okay.
100%.
Okay.
All right, walking through the board of directors report. First, thank you everyone for public comment. We will be discussing the health and safety plan as part of the board of directors report. The first thing on the board of directors report is to approve the meeting minutes from the reorganization meeting at the December 6th meeting, as well as the regular board meeting at the December 6th meeting. There were 2 errors in the presentation of the items at the December board meeting. And I wanted to make sure the board was aware of that in approval of the minutes tonight. The minutes reflect the correct information. The 2 notes were under the personnel section, F3. We talked about some incentives to create opportunities to attract new employees to the school district. In that section, we talked about changing the approval, the substitute rates with our contracted provider, STS. It was noted that they were 110, and we're going to change it to 130. And for our daily subs that are always here every day, 120 to 150. That should have been 100 instead of 110, and it should have been 110 instead of 120. So it is corrected in the minutes now, but I just want to make sure that as you approve the minutes tonight, you know you're approving the corrected note. And then the other piece that was brought to our attention by Mrs. Hune, you approved a tax collector, which was Susan E. Davis. She was approved as a district township tax collector. That should have been the Topton Borough tax collector. You'll be approving the district township tax collector this evening. So the wrong borough/township was identified. So just want to make sure you knew that. It is corrected in your minutes now. So again, what you'll be approving tonight is the corrected version. Any questions on that? So we have policies this evening. The first section under B are the second reading of policies. There are 5 policies there. We, just as a reminder, our policies are broken up into different segments. We have went through a process of a 6-year cycle of looking at our policies. We are restarting that process all over again, and we're starting with the business section as our initial policy. So we're going through those bit by bit, about 5 to 6 policies every month. you'll have a chance to see the policy for the first time, and then you'll see them again at the second meeting the next month, and then that's when they'll officially become school district policies. So this set under B, if there are no corrections or adjustments that need to be made to those, will become the official district policies after this evening. And then item C is a first reading of policies, and those are cooperative purchasing agreements, payroll authorization, payroll deductions, payment of bills, and use of facilities. So those policies are updated policies. Mr. Huerco has taken the lead on this, and as you heard from our auditors, these policies are a key piece to making sure our processes are intact, and you as board are setting these processes in place using policy. So there are not really any massive significant changes to these policies to note. Mr. Huerco, do you just want to walk us through a couple of the highlights here?
Yeah, so I just want to point out the, I guess, significant changes if there are any. So if you go to policy 614, payroll authorization, kind of what we talked about earlier, there are board policies, but there are also federal, state, and local laws. So we kind of incorporated a lot of areas that will say, you know, in accordance with procedures established by, say, the superintendent or designee. But we also put in accordance with federal, state, and local law. So you'll see that in 614 in a couple instances. So policy 615, just a minor adjustment on wording. It kind of got too specific on payroll deductions for employees. It said, so we simply put for approved purposes, although it typically is a 403B tax deduction or appreciation dues. But say if we would do something else, that kind of allows that ability, as long as it's for the approved person, that approved reason that the employee had intended it to be deducted. And then policy 616 is the payment of bills. The only small minute change was list of bills shall include. Back when this was initially approved, we only did checks. Now we do electronic payments, so I just added that simply in there. And then the last one, kind of out of sync, is the use of school facilities. The focus was on, again, we're going through kind of the food service audit, trying to update if people rent our, say, facilities and they want to use our kitchen. Kind of go into the fact that, you know, you need to have somebody that's serve safe compliant, somebody who can food service cafeteria, that kind of has that expertise to run a kitchen, and it's not your typical kitchen that you have at home. Some more safety protocols, and then just kind of some minor adjustments about, you know, what's allowable, not allowable on the property. That's more of the legal aspect. Kind of also, toward the end, leasing of facilities and also unavailability of facilities in that, you know, there's a weather-related issue or, you know, any other related issue. We have the ability to cancel rentals or, you know, close facilities to anybody that has intended to use them.
Any questions on those policies or the adjustments that are being recommended this evening as a first reading?
And as the first? No, second reading, I have a question.
Okay, yes.
Item C2, the purchase subject to bid quotation. I'm curious as to what the trigger is now to require quotes. And according to what I've been reading in the markups and what have you, it was currently 18,500 with an increase limitation of 3%.
Yeah, so that
what
changes annually. I believe it is 21,900
Yes,
for
it
this
is.
year.
21,009.
For that is to go out to get an RFQ, just to get 3 quotes. I believe it is 11,800 for this year, and that changes on the first of every year.
Well done. I just was pulling it up. You have the numbers exactly down the. It's like you're the business manager.
So,
I have two on the first reading. Ken, you go.
no, I'm done for that part.
Thank you, Ken.
So I had a question on the first reading. Why did we include medical marijuana on the prohibited items? Like it's literally the only like prescription that's on there that's they're saying is prohibited. I mean, are we prohibiting people from using Oxy or Valium or whatever? This is on the building use.
Building use.
Yeah. I just thought it was kind of funny because I'm like, dude, it's like it's medical marijuana. It's actually listed as medical marijuana, not listed as like, you know, somebody using it by themselves. Is that something that we're precluded from allowing because we accept federal funds, or? Okay. We're not allowed to have, people aren't allowed to use medical marijuana in the building because we take federal funds.
Hold on.
Well,
There's,
Let me,
allowed
let
to
me,
use it, but not on school property.
oh, not on school property. Okay.
They take it before they come to work and say.
Exactly. Well, no, this is for use outside of, this is for use outside of school then, right? So it's like,
You guys are getting in the weeds here on this
a
little bit.
little bit,
But the fact of the matter is
but
this.
then, like, if you
So
want to
there's
get
two
the weeds, why they put it
different
on paper?
There's two, because technically medical marijuana is not approved by the federal government. And therefore, if you're receiving federal funds, you know, the federal government has indicated that there's a possibility that they can remove federal funds for allowing legal marijuana to be used on your school property. So you have to be cautious of that. There are options that we have that we can deal with, and we've dealt with it in other districts about how that can be done.
Okay.
But you also have to understand that employees have rights, and they can do medical marijuana. There's just certain rules and regulations that have to be in place to make sure that you're controlling that no one's coming in here and causing health and safety issues because they're on marijuana. So there are processes in place. There's also processes in place for students as well.
Okay.
So
That's kind of more what I was thinking, right? Because you hear the stories about, students that have, drug resistant seizure disorders that, for some reason, that seems to be the thing that stops them.
There are processes in place to take care of those situations.
Okay, like I said, it's the only thing that says medical in it that seems to be precluded, and there's a lot more nasty stuff out there than medical marijuana. So, okay, cool. Just wanted to know why it was being called out. Does it work?
Mr. Wagaman, Mr. Potter, it's Liz. I'd like to chime in with two quick questions on the policies. One is in the first section under 610. So there's two headings there. One is authority and then guidelines. Under the guidelines heading, there's another heading called competitive bids. And the sentence I'm questioning is that first sentence under competitive bids, where it requires the board to advertise once a week for 3 consecutive weeks in 2 newspapers of general circulation. And again, I recognize this is a second reading. I apologize I didn't question this last month, but I just caught it now. Given the prominence of the web and online opportunities to sell things or to offer our bids online, I'm wondering, maybe this is a question for you, Mr. Pratt, do we have the ability to replace one or more of those newspaper solicitations with more practical, more broad-reaching online opportunities?
Hi, Liz, it's Nicole. I can actually answer that for you. So this actually goes back to the school code, which is back in 1949, and it has not been updated, but still does require 2 newspapers of local circulation. Unless you have 2 newspapers that are not within your general area, you can apply for an exception. But unfortunately, we do. But I mean, that doesn't allow us. That doesn't mean that we can't go above and beyond the 2 newspapers, but that is still a requirement. Like we still advertise, online via the website, whatnot.
Okay, thank you. So it's a requirement. Appreciate knowing that.
Yeah.
And then the second question, bear with me, was on the facilities plan. And Mr. Potter, maybe your memory will help with this. Back in the day, quite a few years ago, there was a limitation set on Sunday usage of our facilities. And I just wanted to confirm that that is not the case any longer. Is that correct? Is my understanding correct?
No, there is a limitation. School facility rentals begin at 12 p.m. on Sundays.
I apologize. I'm trying to mute so that you don't hear my phone ringing, my house phone ringing. Okay, so would you be willing to say that again? Beginning at 12 noon?
School facility usage begins at 12 noon on a Sunday.
Okay, and is that written in this policy, or how would folks know that, and how is that enforced?
That is in the on the application for the school facility use. When you go in to look at the school facilities, that's where that's applied.
Okay, great. Thank you. Appreciate it.
Absolutely.
Any other questions in regards to policies? First or second reading? Hearing none,
All right.
moving on to D.
So item D obviously there's a presentation here. Before I get started, there's 2 unique pieces under item D. Neither one of these have to be accepted by the board tonight. You can scrap both of them, you can start something new. But we do have to reauthorize the district health and safety plan. It is a requirement this year that we have to do it. We have to create one at the beginning of the school year, and we have to reauthorize it every 6 months. So it's our time. It just happens to be that we're starting controversial. It's been controversial the entire time, but it seems to be that we're kind of at that point where we need to discuss this again. So it fits well with the 6-month renewal process. So what we tried to do this evening was to put 2 plans in front of you. Again, you can modify one of them. You can choose one of them and say this is the one we like, or you can do something different. But the 2 plans in front of you this evening is to maintain the current health and safety plan, and I'll walk through that in a second. It's slightly updated, or you can choose to adopt the alternate health and safety plan, and the alternate health and safety plan outlines a purely mask optional, and it eliminates the concept of some kind of metric to determine if masks are going to be applied in a building or not. So that's the difference, holistically speaking, between the current health and safety plan D1 and the alternate health and safety plan D2. It's the mask, the case count metric that would be related. So before we begin that conversation as a board, the administrative team has been working on a request from the board that came out. The December meeting was, let's look at the data, and can you provide a data presentation to the board at the December meeting? And so that's what we're going to be going through this evening. As we go through this, the agenda is we're going to be looking at the case counts, what some of the hospitalization data is locally, what the local school district is, and then what some next steps are. So the concept here is we want to start high, what's happening at the state, and then work our way down to the county and to the local. We've used a lot of our experts within the community, whether that be the St. Luke's Medical Network, that is our direct medical partner as a school district, or the Berks County Emergency Services, or other resources that were at our fingertips. And that's what we use to pull this data points together. The goal of tonight is just to inform the board. Again, the request from the board was, can we see a data presentation of what's happening so we can make a better informed decision? So that this hopefully will give you a perspective. We all read the news, we all see all the information, so you have an understanding of what's going on, but it may be enlightening to see the specifics of what's happening within our region. So case counts, again, starting high, coming back down. Pennsylvania, the way this graph is set up, and I'll just take a moment to talk about it, and I know it's hard to read with the data points. These are provided by St. Luke's, but really came from the CDC. You come over here, this says July 2020, this is January 2021, you have July 2021, and then you have January 2022. So that's your timeline. You'll see this framework of a presentation through the next couple slides in narration, so that's why I want to spend a couple minutes just talking about how this is set up. As you can see, the number of cases is at an all-time high compared to even where we were back last year in January, and even last year in January, we decided to do that virtual learning, and we adjusted our plans and created that buffer zone for contact. As you can see here, we're a lot higher now than even we were there or at the onset of this whole process starting back in 2020. Here's where we are in Berks County. Similar to the state, you see a very similar roller coaster ride. Spikes at the winter time, kind of ebbs and goes down in the summer months. When you look at the summer months here and here, winter and winter. Interesting spike here in Berks County versus when you look back at the Pennsylvania data, you don't see that quite as much. But we get a few spikes in Berks County last winter. And then, of course, right now, as we all again mentioned earlier, see in the news a lot of spikes of cases right now. This is a regional vaccination status. So the way this slide is set up is it talks about the county. So this is provided by St. Luke's, but it uses the data sources here. So Berks County is the first line, and then this is the Lehigh County line. So if you want to look at some data points of a neighboring county, often we look at Lehigh. The vaccination status is 54.4 for Berks County and 67 for Lehigh County. The data point that we don't have is the number of vaccinations that are connected to our local school district. So that's something we purposely have not collected. We have offered vaccination clinics for our staff. We've offered vaccination clinics for our students. But I didn't feel it was appropriate to collect that data from our staff or from our students. From some of the public comment that we heard this evening, whereas we start to collect that data, it makes others feel that don't want or choose not to have their children left or themselves as staff vaccinated. You want to put them in a situation where they feel like they're being ostracized for not choosing that option. So it is purely an option to have the vaccinations. We've promoted those vaccinations, vaccination clinics for staff and for students, but we have not collected that data purposefully. Hospitalization rates. So when you start looking at cases, of course, the next thing, we've again heard it from our public comment tonight that hospitalizations are high, the cases are high in hospitals. Staff are starting to have an impact there as well. Starting high, same data points as you look at this. This is the 2020 data, January 2021, July 2021, and then most recently January 2022. So what you see here is a very similar, it follows the exact parallel to what the case counts were. Fairly high last January when we had the spike go up then, and then we're creating that peak of equal hospitalization across the state currently within January of 2022.
I'm sorry, what was the number on the other axis there?
That is number of COVID hospitalizations per day.
And what are the numbers specifically?
0, 2,000, 4,000, and too blurry to read. Sorry. It would make sense. It looked like a bunch of zeros, so it's probably 6. So the data point that was presented to us was, and Mr. Volker and Dr. Reese and I had a chance to meet with some of the head medical and epidemiologists at St. Luke's, and they walked us through this slide particularly. They said that this one was presented by the Department of Health, doesn't quite tell the story, but I'll present the data. This is a data chart that shows the percent of hospitalization and the capacity at the hospitals. So when you look at it, again, this is Berks County here, the top row, and then Lehigh is down here. So just to kind of bring that over, this is Lehigh right here, and then this is Berks. So this is your percent change within of the 100,000 population that the data point has been used within the last 7 days. These two columns here are the percent of medical surgical beds occupied, and then this one is the percent of adult ICU beds occupied. And how that relates to COVID, these are the ones that are directly connected to COVID that have the capacity level. So you can see here that at this point it shows that there is a little bit more capacity within the ICU at Ready, a little bit more, taking more of a hit at, sorry, I'm on the wrong row there. That was on the right row. At Lehigh County with 92.1. Again, they felt that data point was low. They thought it was from their local perspective at St. Luke's that it was much higher. But that's the data point we have, and it is the data point to share. This comes from a different data set. This came from the Berks Emergency Management System, and it's the hospitalizations in Berks County, and then the hospitalizations. The data point here and how this chart is set up is it just takes us back to December 24th, 2021. So this is really only roughly 2-week-old data, and you can see. You can see some of the ebbs and flows here of what has happened with the hospitalizations that we were. It's stayed fairly consistent on average, you could say, and it's kind of dipped and floated. The green line is your patients in the ICU, and then your red line is your patients on the ventilator. So hospitalization beds, ICU, and ventilators. That's what those graphs are showing. Again, generalization, things are staying fairly steady, but at an escalated rate compared to what we were previously. So what does that mean for Brandywine in particular? When we look at it from our school district perspective, currently what's happening at the zip code level data is that we are at 1,130 cases per 100,000. At the county level, we're at the 1,100, almost 69.4 cases per 100,000. If you look at this and if you study the data, or if the data has relevancy to you, you'll remember back, if you've been following this, that we set a benchmark of 100 per 100,000 at one point and said, we'll never reach that. Let's set that as our year mark. And by Christmas last year, we had exceeded that. This is obviously higher than we have ever experienced. So we're not using that data point anymore, but it is just a point of clarification. The chart here is the number of COVID cases within the last 14 days within the school district. And so you can see that broken up by the total, by the buildings. Blue is elementary, red's intermediate middle school, and then the yellow is the high school. And then this data point here is two different ways to look at the 14-day running total. So this is since we were actually back in school. So how many cases did we have that impacted education last week? So we were only in school last week, 4 days. This data runs us till Friday. It doesn't count today. So 2 cases at the elementary school last week, 1 at the intermediate, and then 11 at the high school. You can see that there's a translation here. We've had a lot more impact of COVID cases at the high school level. This is the 14-day running total. So how many cases do we have, including Christmas break and when we came back to school? So these numbers would be inclusive of this. And then this is, I put in here italicized reported, because over the Christmas break, we don't feel like we had total accountability of people letting us know what the cases were, just because we were on break, the nature of that. So, but this is the cases there over the true 14 days of what has happened. This slices the data a little bit different. So when we start looking at the cases, we start talking a little bit about quarantines. And so the data points here show the number of quarantines that happened just while we came back from school. So from that January 4th to January 7th, you can see the data points here. We had 159 students, 9 staff that were quarantined. This is a breakdown by the building affected, and it parallels closely to what we saw with the data points here at the high school being higher. 58% of the quarantines happened in the high school, 17% at the elementary school, and then 24% at the intermediate middle school. So the high school, again, is definitely where we're feeling the biggest impact currently. And that is a change, because previously it was fairly equally distributed. Maybe one building would spike a little bit higher than the other, but we really have never seen such an overwhelming impact of one building compared to the others. This is something unique for us. This is yet a different way to look at the data, and so this is the average quarantines per case. So we went back and looked at the data from in December and January, the month of December essentially until January 1st. And the reason we did that is following what the CDC and Department of Health are telling us. If 2 people are masked and there's a close contact case, the other individual, let's just say I'm positive, the other individual does not have to quarantine. That's when 2 people are not wearing a mask. And I should say not people, I should say students, because it's specifically 2 students. If one person is not wearing their mask and the other person is sick, both individuals would need to quarantine. That's the rules. That's what we have to follow for the quarantining process. So previously, when we had full masks and it wasn't an option, we had 3 cases per 3 quarantines per the infected case on average. And now with the mask optional after January 1, so just last week, we were at 9 cases per 9 quarantines per the 1 COVID positive case.
Do you know how many of the 159 that were quarantined eventually tested positive?
I don't have that data point. I don't have that data point. And
I know the nurses keep that. I know the nurses have it.
so we don't have the data point to say here who is the quarantine and then transition. We have a massive running log, but when someone transitions and turns positive, we change the data on there.
But wouldn't you
And
know because?
Well, we're not. So we don't have that data point this year. Right, so we can do that moving forward, but right now what happens in our mass Excel is we have all the data points, all the communication logs, but they change over. Once they change over, we recode them.
But wouldn't if they turn positive, then actually their quarantine is less, so you would know because they become back after.
Yeah. So there'd be.
Would you be willing to speak up when, with the conversation happening? It's just difficult to hear out here. Thank you.
Sure.
So to your point, we can start tracking that, but at this point, the way the data Excel is set up is we don't have that data right now. So even the way you look at that, I mean, cheating is in it every single day. We track the quarantines, we track the cases, we track if they were in schools to know if it was during a contagious period or not. We track all that pieces because there's so much iteration of what has to go into making the decision of a close contact, making a decision if that close contact was in school or not, if that positive case was in school during a contagious period, which is the 48 hours prior to testing positive. There's all kinds of things that we have there. But the data point to say how many quarantines turned into a positive, we don't have that right now. And I knew I was going to ask for it. In fact, I asked for it and said, where are we? We just don't have that.
So you don't know the date that they re-entered back into school?
Yes, we know that.
So because then if they were, if they were out full 14 days, then you would know.
Right. We could go back and do the historical, look back and try to calculate that, but there's thousands of names on that list.
That's what's affecting our kids staying home for a very long time. I mean,
right.
Just the one data point that I have is Twin Valley. That's in the beginning, that's how they determined to end quarantine because 2% of the kids who were quarantining were getting COVID.
Right.
2% actually.
Only 2%. So they said the quarantining isn't helping. We're just going to stop quarantining so the kids could be in school.
Right.
That seems like a very important data point for us to have if we want our kids in school.
Fair enough. And like I said, we can start tracking that, and we absolutely will. But I don't have that right now to give you. Okay. And it's a fair point, and we'll start doing that. I don't have it right now.
Parents, I think, too.
Yeah. And the reason we don't have it is because the rules from CDC say this, or the Department of Health say this. And so that's what we've been operating under. And so there really was no need to track, well, which one of these turned positive, which one, because we were following the guidelines from the Department of Health. And so,
would you be willing just to reiterate what was the question asked and the data that's not able to be currently reported on, please?
We had asked of the 159 students that were required to be quarantined because of close contact, we wanted to know how many of those actually then were tested positive. And we don't know that information. That hasn't been tracked. Whereas Twin Valley School District, they were tracking that and they found that only 2% of those kids that were required to be quarantined actually ever tested positive, actually ever ended up getting it. So that's why that school district got rid of the quarantine measures.
Like I said, I knew there was going to be a discussion point. I kind of guessed you might ask that, Mrs. Eisenhart. And I asked the question in anticipation of that. And I'm sorry, I don't have it. I wish I did because I anticipated it. I don't though, I'm sorry.
I know. It's just spent a lot of time pulling up hospital data that doesn't have anything to do with our kids. And data that does have to do with our kids isn't there.
Fair enough. So this is the rules relative to quarantine. So when we make these determinations of who is quarantined, this is the rule. And it's what I mentioned earlier about 2 students are masked regardless of vaccination status, do not need to quarantine. The Department of Health has changed the regulations again as of Friday, and it's now called PA HON 619. In some ways, that has worked to our advantage. The second to last iteration was PA HON 615, and the difference is this one right here. So this one is talking about adults essentially that need their primary vaccine as well as their booster shot. Originally, it said students needed their primary vaccine and their booster shot, or they had to quarantine. So there was a bunch of students that we had to quarantine last week because they didn't have their booster shot. Probably, and I dare say unfairly, because the booster shot just got authorized for students. So that has most recently changed. The CDC changed their stance mid last week. Department of Health on Friday came out with a new update. This update actually isn't even on the Department of Health website yet, but I was able to get a copy of it, and it is the official new guidance. So that took effect Friday, and it will help to eliminate some of the quarantines. And then anyone that had COVID-19 the last 90 days also do not have to quarantine. So this one doesn't affect us directly, but affects us indirectly. And I'm not sure if everyone knows that this is out there, but if you have a child in a daycare setting or a child care center, the Office of Child Development and Early Learning is kind of like the Department of Education for early childhood settings. And so their ruling is that if anyone's showing symptoms, they have to have a doctor's note to be able to come back to that daycare setting. If someone actually has COVID, they actually have to have a written physician note clearing them. And if they did a home test, they actually have to have the physician or the nurse review that home test to make it valid for them to come back to a child care setting. I say this isn't directly impacting us because we don't have child care settings, but indirectly, obviously, you can see the ripple effect of our staff with young children in a child care setting are falling into this legislation or into this guidelines, and unfortunately, it's causing us some impact to staffing. So that leads me into
Andrew, if you go back to that, it says communicable disease or
Yeah.
infection, so that could be anything.
It's really anything, right?
Chickenpox, it could be the flu. They're kind of jamming up people. It could be the stomach.
But they're couching it under the COVID. Yeah.
True.
Yep.
True, but like the way that reads is anybody that wants to come back to a daycare needs a doctor's note that their kid has a stomach bug.
And stomach bug, yeah.
And
Crazy.
if I may, this was recently added to from the Department of Health to daycares, as they have a list of communicable diseases that have to be reported. And up until this point, COVID-19 was not one of those communicable diseases. They had to report to the Department of Health. That's why that terminology there is communicable disease.
So there's some staff impact charts here. I'm going to leave that up. It kind of is self-explanatory. And then there's some vacancies. We've been talking about vacancies. I put that up there. When we talk about the overall impact of operations, this is something that the board, I think, is important for you to know. But what I want to do is just take a moment, and Mr. Frieda just started sharing a little bit about the impact with childcare settings. I thought it'd be important for the principals just to share a little bit anecdotally about what they're experiencing, so you understand the operational challenges that we're having at the building level, and they're the best ones to talk about that. So I'm going to start with Mr. Frieda, and he's going to share a little bit about this exact thing, the childcare situation.
Sure, I think the childcare is a huge thing that's currently impacting the buildings. When we look at staff outages, we have staff who are out because they are a positive COVID case or they are waiting COVID results. We also have an almost equal amount of staff who are forced to miss work due to childcare issues that are arising because of COVID. And as Mr. Potiker shared on that last slide, this whole new concept, which just was rolled out through daycares at the end of last week, is really going to impact staff. Because staff who have children at daycare, which is a large percentage of staff, they will now have to be out with their children until they're able to get that result back, or if it is that 10-day. What we're really seeing through our nurses and just across the board is that due to the large number of people being tested, PCR test results are not coming back within less than 5 days. And a really great example of that is we had 2 students who were tested for COVID last week. Their test results did not come back until Sunday, So any student who was exposed last week, their quarantine period of 5 days had already elapsed prior to us even receiving that positive test. So PCR test results are incredibly delayed, which is going to impact that childcare delay. And where we really see that being an issue from the staffing standpoint is on multiple occasions, staff members are getting phone calls at 9:30 in the morning, 1 in the afternoon, that they have to go pick their children up. So obviously we're letting those staff members go take care of their family because family is the most important thing. And then we're internally looking to cover those classes, looking to make sure that those classes are covered. So when you look at those statistics that are up there across all three of the buildings, this does lead to a number of shifts. We've all taken a number of opportunities to substitute. We've all taken a number of opportunities to work in our cafeterias and all of those things. So it does create a large impact on our staffing ability. But I do think too, it's also important to point out just the absolute professionalism of our staffs, our teaching staff and our nursing staff. With the positive cases, with all of the cases coming in, it's not uncommon for our nursing staff to be making phone calls on all day Saturday, all day Sunday. It's not uncommon that we're reaching out to our teachers just to confirm close contacts. So, there are a lot of ripples due to the daycares. There are a lot of ripples due to the positive cases. But our staff is really doing a tremendous job, as they always do, answering questions outside of their work hours. So, that's kind of what we're seeing across the buildings. But this new daycare change is something that I do really think is going to impact us from an overall staffing perspective.
And if I can just echo Mr. Farina's sentence before, just the gigantic thank you to my nurses, to my staff. What we see at the high school is we're already operating a little bit short because we've had, on average, 2 unfilled positions throughout the entire year. So, again, I'm blessed and thankful for the substitutes that we've had that have been with us, because those substitutes have been filling positions that were already unfilled throughout the year. But what that leaves us between the sub shortage and then the applicant shortage is, at any point in time, if I get 2 or 3 or 4 outages, what ends up happening is we're drastically short at the high school. So in an 8-period day, my teachers do sometimes have that duty period for coverage, but we find that traditionally what was used, sporadically at different times of year when we would get tight, we're not utilizing every day. And it's hard because I have some teachers that teach a multitude of subjects in their day because of the different offerings that we have that now, in addition to that, are covering classes. It also puts myself and my counselors, my administration, Mr. Barnhart, and myself in positions where we're covering on average, 2 classes a day in addition to our lunches, because we don't have enough staff in there, which again, it is something that we can completely do, but it's starting to affect some of those areas we're seeing where we're getting to things like all of the contact tracing that's necessary at the high school. You see that it's been rough since we've been back from break. To get to those pieces that's been there. So again, the professionalism of my staff and what they're doing every day has been phenomenal, but we've really seen the pinch because we're already short every day, that just getting those classes covered has taken every single one of us, from my counselors serving in lunch roles or in classrooms, to the teachers just pulling together and doing everything we can to kind of keep everything going, and provide the best for the kids, which is the most important part too. So it's just kind of what we're seeing right now, and the pinch that we've been feeling for most of December, and definitely since we returned from break.
Yeah, definitely a team after that. Mr. Ginch has been filling in several times, 4 or 5 periods a day. Top G principal too. So
Getting pretty good at a lot of things.
And I don't have too much more to add to Mr. Ginch and Mr. Farina's comments. At the elementary school, our coverages are a little bit more unique. We don't have coverage periods built into. We don't operate on a period-based schedule. So sometimes when we are very short staffed, we resort to splitting classes, which we really try not to do. I thought just as much as I can, utilizing as many other staff members as we can. But as we're looking to contact trace with mask optional, when we're looking to follow the quarantine guidelines, if there's an event where I'm looking to split classes and we are mask optional, it puts a lot more students out. If there's a handful of students that are unmasked with another class members in there because we're splitting, just thinking of numbers wise, phone calls wise, where my mind goes of where we've been this whole year of what that process looks like. It's definitely being non-optional. Adds another layer of difficulty to our already set price. So just something to think about with our daily operations.
Any specific questions for the leaders of the different buildings?
Question, maybe for you guys or for Andrew. When you go back to the other slide with the quarantining when masks were optional versus masks required, what accounts for the 3 per, so when does that become a close contact in your contact tracing? So if everyone's wearing a mask, when does that happen? Does that happen at lunch or?
And bus. So the governor's order had an exception to it, that if you're in a classroom and you're 3 feet apart or greater and both parties are masked, you do not have to quarantine. That exception was only in a classroom setting, which a bus is not considered a classroom setting. So if 2 individuals are masked completely but within 6 feet of each other on a bus, they would not be granted that exception and would have to quarantine.
For us, it was lunch only when parties were masked. When we discussed that with the kids, we keep a seating chart of lunches, and you were aware that who you sit with at lunch could possibly be who a quarantine might result in. So when we were mask required, the only time we would need to contact trace would be during lunch. When masks are optional, then you equate it to the 8 periods a day that the students are in, and you can see that number go with us.
Actually, just anecdotally for the high school, like my high school student got burned in the parking lot before school started because the kids congregate out in the parking lot. They all are jumping in and out of each other's cars, and you can end up with contact out there, especially if they're not wearing masks. So
quarantine is the problem.
Exactly.
So let me go into the next steps, and then it'll be, we'll turn over to you as a board to ask questions and really deliberate and decide where we want to go. So this came from the Berks County COVID Health Advisory Panel. This was recently released. And the reason I bring it up, they made 6 recommendations in the report. And what I found interesting was in some ways it's a little bit of a prize point. We have done all 6 of these things. So promoting immunizations to students and staff. Again, regardless of what you feel about the immunization and the vaccinations, we're not collecting data, so you do what you want to do, what you feel is right for your family and yourself. I'm not going to get involved in that. But if I can create an opportunity within the community, knowing we don't have a physician, a pediatric center in Raymond, let's do that. Let's create those opportunities. And so we did vaccination clinics. We did one back in June. We did another one in November, and then a second dose in December. This was the May-June one. And then we also did one for our staff, most recently for the booster and flu vaccines. Social distancing was the second recommendation, and we've been really working to implement that. Now, admittedly, with all students back and with some of our space limitations, particularly at the high school, it's a little bit harder, but we have definitely worked to try to put those things in place, and we still have the plastic desk dividers from last year available, and those are all in the classrooms for any teacher that feels that they would need to use that. Proper cleansing of touched areas, sanitizing desks, touch points between cafeteria, between lunches. The custodians are spraying down cafeteria tables before the next group of kids come through. Testing measures, implemented test to stay. So we were the first in the county to offer the rapid antigen test. It's something that I actually am fairly proud of. Again, whether you want to do it or not, I go from the perspective of let's create an opportunity so that way if you need that ability to be tested, here's an opportunity for you. And so it was very difficult to get tests. It's very difficult now to get tests outside the school district, but now you can come in any day that the school is open from 11 to 12 and get tested. Revised protocols for quarantine, so we're following that. The updated 615 now to 619, and then universal masking. That's what we're essentially going to spend a lot of time talking about.
This is what's happening at the county level. So when you start looking at, a lot of times the question says, well, what are other school districts doing? This is what other school districts are doing. Mask mandatory, 45%, mask optional, 35%, that would be us. You know, I put a mask optional in there from any school district that reported that they had some kind of metric or were purely optional. I'm sorry, this was a purely optional. This was the one based off of metric. This would be us. So any district that had some kind of metric related to mass is in there. So 20% mass based off of metric, 35% mass optional, and then mass mandatory 45%. And then this is the quarantine following the Department of Health, which is 5 days versus the 10 days or some alternate form of quarantining is there. So alternate form 15%. The other one I think is would be about 84% that's following the Department of Health for the 5-day quarantine. This is the, I mentioned earlier, we had a chance to meet with St. Luke's and their top leaders, and this is what they recommended to us. They are recommending full mask mandates, a little bit different than what we're going to be looking at here in a second, but that is what they're recommending at this point. This was a source, so I mentioned we had a chance to connect with a lot of different emergency management system, to St. Luke's, to a whole bunch of other outreach partners. So final slide here, what's the goal? And I think that's what's the important thing. And Mrs. Clark, I think you did a nice job of trying to outlining that as a parent perspective. My goal is to get my child in school. And that's what we want. Our goal is to maximize the in-person instructional time. That's the goal of the administrative team. That's the goal of the entire school district, is to get kids in school learning in person. And when you look at the layered measures and quarantines and rules that we have to follow from the Department of Health, this, I believe, is the best way to address that. And so we are going to recommend this evening to the board that we continue essentially with the plan that is currently in place, which is if there are less than 5 cases over a 14-day rolling period, face coverings would be optional. It would be a parent choice for all individuals, whether that's staff, students, parents, visitors, etc., regardless of vaccination status. If there would be more than 5 cases in that 14-day rolling period, then we would go to a mask mandatory process. The third bullet is face maskings are still required on all public transportation, regardless of if we're optional or not. The fourth bullet is that students and staff who travel to other locations must adhere to the health and safety plan. So if they're traveling to one building and that building is required to wear a mask versus another building that's not, of course they have to follow that rule. And then the last one is one specifically about sporting events, and that is that our athletes currently are not required to mask during their games. When they're not actively participating in games and practices, they do have to follow the mask guidelines that are outlined above, whether it's mask optional or mask mandated. And then spectators would subsequently fall into the same caveat as visitors in that plan. That is what is essentially currently in place, some slight modifications, but that's essentially what is currently in place, and that would be the recommendation. That is what is on your board agenda this evening as labeled as the current health and safety plan updated. That's that right here. The other plan would be essentially these things that are in here, but you would take out this piece of it, which would be the case counts over a 14-day period, and it would be a purely optional moving forward masking option for parents. That is the recommendation for the board this evening based off of the data, based off of the spikes being high. And the reason we're recommending that is if we're seeing more than 5 cases in a building, obviously there's something going on. So we want to make sure that, again, going back to the goal, we're trying to get as many kids in school as possible. And so if that means that we need to wear masks and all of a sudden we don't have to deal with all the quarantines, whether you believe, I hate to say it, but whether you believe in masks or not, you believe in vaccines or not, what we're trying to do here is get our kids in school within the parameters that we have to play with.
And I think this is the best way to do that and still give parents choice. If, if there's less than a certain number of cases. Once we get over that certain number of cases, we saw that last week with the high school, the ripple effect of mass number of students not in school is pretty detrimental to the learning process. So that's a recommendation this evening. Again, I turn it over to the board now for questions that you might have for me, for the administrative team, or dialogue between you as board members to figure out which direction we're going to move forward for this plan.
I have a question surrounding this quarantining, because the way it sounds, one of the things you put in here is the test to stay.
Yeah.
Right, so you didn't really talk about what that means, right? So
Yeah.
unvaccinated, or even not up-to-date vaccinated people, right, could utilize this. They're close contacts, they can stay without quarantining, they test on the first day, what, the fifth day?
Please.
It's 2 times within
Yeah.
a week, period.
Is that what it is? Forgive me, I'm a little fuzzy on that one. Do you remember what it is?
I know it's twice within a week, period.
Yeah.
Alexis, would you be willing to speak up? It's really hard to hear what your question is.
Sure, Liz, sorry. My question
That's okay,
is
thank you.
surrounding quarantining, because if you're fully vaccinated, you don't have to quarantine, correct? So
Yes.
then the only people quarantining would be not up to date or unvaccinated individuals.
Correct.
But we are hoping, or is this test to stay only in the alternate plan, or is it in both plans?
It's in both plans. We have it listed in both plans.
So that kind of eliminates a lot of our issue, because if we have the test to stay, what kind of tests are we using?
We are using the rapid antigen tests that are supplied by the state.
So not the ones that are taking so long to come
The
in.
PCR now. No, we have the results in 15 minutes.
Okay,
And we get those results in 15 minutes.
so that gets rid of a lot of our issues that we're having. I mean, the preschool stuff sucks, but we can't do anything about that.
No, but it's just a data. point.
Yeah, no, I
Yeah.
understand that. So I mean, the teachers who are quarantining because of our home, because of that, isn't necessarily because of the masks and quarantining at our school.
Correct.
So, okay, so that is in both. So basically, it's either to take out these 5 cases or not.
Correct. That's the difference between the two.
But if our kids are exposed anyway,
But if the kids are fully, I'm on the CDC website.
yeah,
If the kids are fully exposed, they can, like, you don't have to quarantine. If you're exposed and you have your vaccine, you don't have to quarantine. The recommendation is that you wear a well-fitted mask for the 10 days,
so if
even
a
if you don't have
kid
symptoms.
is vaccinated, and doesn't wear a mask, he doesn't have to quarantine.
No, if they're not vaccinated with no mask, the recommendation is to stay home for 5 days, right? If they are
But if we're doing
vaccinated,
test to stay,
if we're doing test to stay, then
they can stay and no mask.
They would have to test within the first 4 days, and then they have to test again between days 5 and 7. That's the test to stay protocol.
Yeah.
So then it's still after 5
Well,
days.
no. They can
Oh,
take
they
a
can
test,
still-
yep, right away, and we have the rapid test in each building, so we could administer that test. Again, that's vaccinated or not.
So I just taking the building cases away, to me, if we're not quarantining anymore, because we have this test to say, we have the ability right away to test, we should still have that ability to, even if there are these cases, we haven't identified if is that a spread? Are they getting it at home? Are they we don't know that. We can't control what goes on at home. I mean, so I don't want students to have cases in the school. I always want to make sure I say that out loud. I don't want that. But we already aren't going to quarantine either way. And so what's the benefit? What is the benefit of masking kids afterwards? If we know that there are more than that many cases and you feel comfortable as a parent masking your child, that's your option. But if I don't want to,
But that's the CDC guidance. CDC guidance is to wear masks for 10 days after your exposure. That's what the current CDC stuff is. The other thing is,
so why does the whole school have to do that if the whole school isn't exposed?
well, so if you look at Twin Valley, right? Twin Valley is about 3 times our size. They've had 92 cases in the last 11 days, right? 10 days, sorry. So we've had 11, right? Even accounting for their larger size. They're mask optional, we're mask mandatory. I mean, it's anecdotal evidence, but we're.
Optional the past 11 days.
Yeah, but because our number has triggered it to keep masks on.
In the high school.
Yeah,
In the
so,
first
because
day.
we're following CDC guidelines.
All of those cases were from over break. I mean, the very Monday, 11, or there were how many cases on Monday? Like 7 or 5, or there were other, six. That didn't happen on Monday at school.
Okay. A lot of 5 could have.
Those
But
six-
what I'm
those
saying.
happened in school.
On Monday. They
Yep.
came to school, they got COVID at school.
They came to school and were tested that day.
But they didn't contract it at school.
Correct,
is
but
what I'm
those,
saying.
what I'm saying is those are the ones that we identified as being physically in school
Yeah.
and testing positive that day. There's a lot more, there was like 18 or something like that. Those account for kids that tested positive, but were not physically in the school.
I just don't see the benefit of masking everybody if we're not going to quarantine, we're giving the ability to test. And if my child is a close contact, I can test him, her, and find out positive or negative. That's what I wanted to say.
Well, let me just clarify something with the test to state protocol, just reviewing this right now. Day 0 is considered the day of exposure. So if you're in school and you're exposed to somebody right next to you, they're COVID positive, they're saying the first test could be administered within 2 to 4 days post-exposure. So that day of exposure would be day 0, then be day 1 and day 2. So there would be a day, the day you're exposed, a day in between, and then basically you'd come back that day after, as long as you test negative. That's the test to state protocol.
So they have to go out at some point.
Yes, it would be
For
that.
at least 2 days.
It would be that day is day 0. The next day would be day 1. Day 2 would be the first day they could test.
And where are you reading this, just so I can read it?
Yeah, it's on the health.pa.gov. I can send you the link.
So if it is happening during school week, so say Monday.
Again, folks, please speak up if at all possible.
So if a child comes in close contact on Monday, that is day 0. They can test then on Wednesday. And if that test is negative, they can come back on Thursday. So there is still a quarantine portion to this plan.
And the ripple effect is if you go down this road and do a mass optional, the number of tests that would have to be administered would be pretty exorbitant.
Well, that's my biggest concern with this is, do we have enough? Currently, we have enough tests because it's not being utilized to its full capacity. But if we take this option, I would argue we'll probably be out of tests within a month.
But it's in both options.
If I can briefly too, if we expand that number of tests across a number of students, one high school student takes out 15, 20 students, that's 15, 20 tests, the strain that would put on a nurse's suite is just something to think about. That's all.
That's in both of our options right now.
It is, yeah. But the difference is if we go this, and we're at an escalated level like the high school currently, and there's 2 people where we don't have to even do the test this day because there's no need for a quarantine.
The only way that would become taxing is if we go with masks completely optional, regardless of building temperature. Then we would run into a testing issue. I'm certain of it, as well as taxing the.
I don't think of the amount of tests is the concern. I think of, every test requires a 10-minute turnaround, and then also the management of the test itself. That could just be, with 1 nurse per building. Have to consider some of what they're doing in their time too.
If this is something we want to do, we'd have to just maybe look at some alternate pathways for staffing. It's actually free.
Oh, right on.
Yeah, we get it from the state, so that's great.
For me.
I think we'd have to look at staffing, and be able to maybe partner with a contracted service for the end of the year. That's something we can easily do. And, I think the perspective, again, we'll go back to our goal, but I think the other thing is we're gonna end up having to find, some way that we're gonna live with this new company. There's gonna be different variants, there's gonna be different, how do we get to a state where we can, everyone hates the word, but come back to some kind of normalcy to make this work. There might be some costs that are associated with that in terms of if we're going to go this route and you want to go down a purely optional, then let's practically look at the trickle effects and make sure we put in some supplemental things to be able to handle that extra burden.
Mr. Potter, just a quick clarifying question. Did you mention
earlier that hold on 1 second, Brian. Liz is talking as well. Hold on, Liz. We're across the room here. We've got two. Brian, say that again.
You're moving, Liz. They're transporting you.
All right, Liz, go ahead.
Now you can see me?
Yeah, hi.
Maybe that'll be better in terms of my ability to hear the discussion. Thank you, Tom. Quick question, Mr. Potter, just in terms of clarifying, did you say earlier in terms of the way positive cases get reported, what we're tracking is when a positive case essentially gets identified during the school day?
We track.
In all likelihood, that there were other positive cases, for example, from students over break or students on the weekend or whatever, that we are not including in our numbers.
We track two data. We track two data sources. We track all the cases, and then when we look at a positive case, we identify if it is a case that they were in school and had contact with other students, or if they were not in school and didn't have contact with other students. If they were in school and had contact with other students, that of course starts to trickle the contact tracing process and potential quarantines. So we are collecting all that data.
Okay, so the ones that are, if we stuck with counting of the cases and stuck with the number 5 or greater, then those are the cases that are triggering contact tracing. There are, if I understand what you're saying correctly, there are also other cases that are not included in that 5 that are actual real positive cases, correct?
That's correct.
Okay. So the number 5 is not particularly aggressive because there's more case positives than we're actually counting to trigger that number 5.
That's correct. We're only counting the cases that were in school.
Okay. And I have one other clarifying question, just real quick. Page, I think it's 21 of the slides, is the two circular where we're looking at the Berks County School District mass plans. And on the right side is showing what schools are doing in terms of quarantining. So for some reason, I thought the requirement to quarantine was a mandate driven by the Department of Health. But this would indicate that some schools have elected some kind of option. Could you clarify for me how that works, how that's optional?
So there's two unique data points within that smaller blue dark section. There's some school districts that chose to keep with the more stringent 10 days instead of moving to the 5 days. And then there's some school districts that are not doing any quarantine process at all.
So the dark blue category called alternate quarantine is either no quarantine or a diminished quarantine based on the most recent recommendations.
Not diminished, increased.
Oh, increased.
So that they're sticking to the 10-day quarantining instead of the 5-day quarantine.
Oh, okay. All right. So it's not necessarily showing the magnitude of the quarantine. It's showing those who are like us at 5 days and those who are not like us at either no quarantine or more quarantine than us.
Yeah, exactly. So really the data point was just to show that 85% of the schools are doing what we're doing and electing to go with that new 5-day rule.
Okay, and remind us, when did that new 5-day rule happen?
That was that PA on 6/15, so that was within the last 2 weeks. I forget exactly what the December 30th.
Okay, so just basically this current school year, 2022, okay.
I know Brian hasn't mentioned, but what Tom sent me, it does say, after being identified as a close contact, test to stay program participants can continue in-person learning education if they remain asymptomatic and continue to test negative. So there is no quarantine for test to stay.
Okay.
Well, they wouldn't have the results of their first test.
But it doesn't say on here they have to wait for that first day.
Okay.
Say day 0 is the first one, and then within 2 to 4 days is the first test, and then when day 5 to 7 is the second one. That's the point of test to stay, that they get to stay.
So the positive is, again, it's talking about day 0 is the day of contact, right? So it's fairly rare that the day of contact is that day. Usually we're finding out that somebody is COVID positive a couple days after that contact has been made. Does that make sense?
To Mr. Volker's point, when we're looking at, if we're notified at the principal level that a student is tested positive, it's usually not that day when we're looking at close contacts. That student may be out of school, and we're looking back 1 day, 2 days, 3 days to see, okay, when this child was last in school, who would be considered a close contact to that point of 2 days. In most situations, it is day 2 when we're determining.
So they wouldn't need to stay out, they would just test and go to school.
And
Because day zero and 1 would already have been passed.
That's what I'm saying.
In most situations.
So they wouldn't need to be out of school at all.
Right.
We're on the same page?
Yes.
Okay.
Yeah, admittedly, I need to get clarification about if it's day 0, we're finding out. Yeah, I'd need to hear clarification on that part.
Mr. Hohenscheld, you still there?
Yeah, that kind of answered one of my questions. And I'm making excuses with driving here. I don't have all my paperwork in front of me. And two questions come to mind. Andrew Bonniger mentioned earlier about getting back to normal. Is there a plan that, in my mind, with getting back to normal is not having a kid in a mask and not quarantining? Up till 2 years ago, that was normal. So the idea is to get back to normal. That, to me personally, that's normal. And let parents have a choice. And take not the school board deciding what's right for their kids. I mean, I know they're obligated to act here, but do we have a plan that gives complete kid control of mask optional and 0 quarantining?
There's not a plan like that presented this evening, no.
I think that lacks some choice and normalcy, but that's what we got to go with. I would personally prefer the least restrictive. The parents spoke earlier, I thought they were loud and clear, and I personally have to agree with them. So that was just my question and comment. Thank you.
Sorry, Liz, what?
Well, I was just trying to understand. I think we would all love to have this resolved. And it would be great if one of us was brilliant enough to make that happen. But I think the reality of our lives right now is that none of us, no matter how talented or how strongly our opinions are or how brilliant we are, we can't predict the future. So trying to create a plan to predict the future feels a little bit futile to me. I think our focus needs to be on how do we navigate and manage our way through this sort of debacle that society has found itself in. And my biggest concern is what Mr. Farina and Mr. Chinich primarily are saying, which is despite their valiant efforts and incredible amounts of time and energy and talent being thrown at this, that from an education perspective, staffing is a huge challenge. The kids are in school, but not necessarily getting the regular teachers. The education quality is just diminished. So the sooner we try and prevent that from happening, I think the faster we can get to Mr. Hohenschild's goal, which would be sort of quote unquote back to normal.
Trying to catch water with your hands.
So, we have 2 proposals in front of us. Does everyone understand what the two proposals are. So with that, let's take a straw poll for option A.
Excuse me.
Yes,
Before
sir.
we do any straw polling, could the board make comments in addition to what's already been said?
Yeah, by all means.
I've been taking track of a lot of things going on since this whole COVID thing. And one of the things that I discovered, Brown University, this is from November 30th, 2021, about a month or so ago, 6 weeks ago. And I'm gonna read this so I don't say anything out of line. This is a study executed by Brown University has found that the probe analyzed the cognitive development of youngsters from infancy to childhood and adolescence. I'll skip down to what they say here. The report found that there was a 23% drop in scores measuring kids' intelligence quotients since the start of the pandemic. The study also found similar dips in the same span regarding development of children's ability to communicate verbally and subtly. You know what I mean? From 1,600 children, the caregivers who have been enrolled in the study between ages 0 and 5 on a rolling basis. 23% have shown a drop in their IQ. 23% between the ages of 0 and 5 in this study. So that means anybody in kindergarten, preschool, that has been wearing masks has lost that cognitive ability. So we're expecting our children to learn at that young age level, which is only going to compound year 3, year 4, and so on, perhaps. How do we adjust for that? Is my question for that one. The other thing that bothers me very much is that this is going to be a tough one. This is a report from the Defender, which is the Children's Health Defense Organization. The headline here is 16,000 physicians and scientists agree kids shouldn't get COVID vaccine. 16,000 physicians worldwide. The author here is Dr. Robert Malone.
Yes, sir.
Before you vaccinate your child with irreversible, potentially permanently damaging, find out why 16,000 physicians and medical scientists around the world have signed a declaration publicly declaring that healthy children should not be vaccinated for COVID-19. The author is Dr. Robert Malone. And who's he? Have you ever heard of him? First time I heard anybody else mention his name was this lady here tonight. So I think she's been sort of along with me in the same path of trying to discover what's right for our kids, both cognitively and medically. He is actually the inventor of the mRNA vaccine. He holds 10 patents for this. He's the leader with other associates in doing this. I hate to read this out loud because it's scary as hell. But this, I'm going to read it to you so you have the same information that I have and that this lady out here has, and maybe some other members in the audience with children. I think it's important that I share this with everybody so that you can understand maybe what we're expecting. Before you inject your child, a decision that is irreversible, I want to let you know that the scientific facts about this genetic vaccine, which is based on mRNA vaccine technology that he created, he says I created. The first thing is that a viral gene will be injected into your child's cells. The gene forces your child's body to make a toxic spike protein. These proteins often cause permanent damage in children's critical organs, including the brain and nervous system, the heart and blood vessels, including blood clots, their reproductive system. This vaccine can trigger fundamental changes in their immune system. This is the guy that invented this stuff. If anybody has credibility, I don't know who else it could be if he's the guy that's telling me this. The most alarming point is that once these damages have occurred, they're irreversible. You can't fix lesions within the brain. You can't repair heart tissue scarring. You can't repair a genetically reset immune system. This vaccine can cause reproductive damage that could affect future generations of your family. The second thing you need to know about this fact is the novel technology has not been adequately tested. We need at least 5 years of testing research before we can really understand the risks. harms and risks from the new medicines that are becoming revealed many today. Ask yourself if you want your child to be part of the most radical medical experiment in human history. Final point. The reason we're giving you vaccination to your child is a lie, he claims. Your child represents no danger to parents or grandparents. It's actually the opposite. Their immunity getting COVID is critically to saving your family, not the world and its disease. Like I said, he is the Chief Medical Regulatory Officer for the Unity Project, President of the National Alliance of Physicians and Medical Scientists, and he has other resumes on there that are quite great. The point I'm trying to make is, we're talking about masks. I'm concerned about our kids with their IQs going down, which is because they're wearing masks. I know we have a parent optional thing up there. If I had my say, it would be parent optional means my kid wouldn't wear masks. That's my own personal opinion. There are other vaccination groups here. You know, the AMA supports vaccination. This rejects it. Let me start over. Physicians Group rejects the AMA support for vaccine mandates. That's the American Physicians and Surgeons. When you got doctors all over the world and American AMA support for against vaccine mandates, you know, I got to ask, what are we preparing our kids to go through in their future?
In full disclosure, we are not discussing requiring anyone to get a vaccine of any kind. So I understand everyone has their own thoughts on vaccines.
Here's where I'm going with that, Mr. White. Here's where I'm going with that. I mentioned this earlier to our attorney, Mr. Pratt, and Mr. Pottinger, and Mr. Volker. We have our kids getting vaccinated in our school. Along with what was the name of the pharmacy that came in here and set us all up?
Question Pharmacy.
Yes, Oakside, and whatever. You know, how did we come to allow that to happen on our premises without considering? Do we have a formal consent that the parents can sign for any of these risks that I just reviewed?
There is a consent that they gave to receive the vaccine.
All right. So
same with the testing. So anyone who comes for a test, they have to sign the consent for the nursing or whoever is conducting the test to do so.
Well, again, I have a lot of more information here. I certainly don't want to go through all. I think you got the gist of where I'm at with this. The simple thing I want to say is, I don't want to be held culpable to doing any damage to any child that was in our school with our nurses injecting them with this vaccine. I know they got a consent form, if the parents assigned it, that's fine. But that never stops those parents, if something goes wrong, coming back and suing the district, which would put a financial burden on the district. As Mr. Pratt solicitor told me, that's what we have insurance for. I don't like that answer, really, to be honest with you.
Same with someone getting COVID though with a mask optional. You have the same, what I'm saying is you have the same risk. So if a student came down with COVID and a mask optional, that parent would have just as much possibility of suing the district. We would still have to pay to fight that, no different than them tripping on the sidewalk. So we face those challenges every day. And I hear what you're saying, but that's part of doing business here as the district. So those risks are there.
I want to ask a question. I hate to ask it, I really do, because it's so, I don't want to really know the answer, but I got to ask, how many fatalities have we had in our district? Students, support, anybody? Any fatalities? None. What does that tell you about COVID?
Well, that's not necessarily true. And it depends how far you want to take that. Whether you're talking grandparents, so there was just one this past week, drivers, contracted, that has happened.
I said no students.
No, oh, no students, okay, yeah, okay.
Students, faculty, administrators.
We've had staff.
We had staff.
Yes,
How many, may I ask?
I don't know the number.
How many is enough, Ken, to make you change your mind or take it more seriously? Would it have to be 5 or 10 or 30 or 50 of our faculty, or 12 of our kids? How I understand your question, but what number would be the right answer here?
I don't have an answer for that. I don't know. All I can say is, whichever plan allows the most flexibility for the parents, guardians, whoever, in charge of the kid coming into school, like whichever gives the most flexibility, whether the option to mask all the time, whatever it takes. I think we have to be careful that we don't impede progress of education or our kids. That's why we're here to begin with. This is a dirty thing that we've been dealt. We have to deal with it. I understand that. But at the same time, let's not go too far before we do more harm than good. Thank you.
Just as one counterpoint, and Mr. Hefner, you know I respect you. However, there have been doctors and there have been scientists that have been disproven putting out information.
Such as the CDC and Dr. Fauci, you mean?
Such as the gentleman that said vaccines cause autism. He was disproven, he was stripped of all of his credentials, and he has been proven time and again to have been a fraud, right? However,
that was only after a period of time.
It doesn't matter. You have children that have died as a direct result of somebody just trying to make a name for themselves, right? And I don't know this gentleman that you're talking about, but I can tell you, 16,000 people in a world of 7.5 billion is not a lot of people, right? And I bet you I could find, on a scale in this building, I bet you could find 16 people that agree with me on anything. 400 and some odd thousand people actually believe that birds aren't real. They believe they're CIA drones, right? That doesn't make it fact. So I think one of the situations, I understand, it's alarming when you read that sort of information, but the background of this stuff is it's been around for 50 years, right? They've been experimenting with it to treat cancer. They found a delivery method. The other thing that I'm really not understanding is everything that we're looking at is showing that, masking and our current plan is working. And I get it. Everybody wants to go back to what it was. But to kind of use a crass statement, we can do something in one hand and we can wish in the other and see which one fills up first, right? So I really believe that staying the course is kind of in the best interest of everyone at this point. I get it. People don't like wearing masks. I don't like wearing masks. But you know what? If I'm going to keep people around me safe and healthy, I'm willing to take it. All right?
We don't even know if that's true.
What's that?
We don't even really know if that's true.
We haven't gotten to try this way. I mean, we haven't gotten to try no way yet either. So we can't, your bucket works that way too. We've
Sure.
never tried no masks, no quarantine, just.
Sure, but I mean, I've been working for the last 24 months on an ambulance wearing a mask. I didn't get COVID from the ambulance, right? I got COVID from my cancer patient father because that's how life works sometimes, right? So again, it is one of those things where we're basing a lot of this conversation on anecdotal evidence and anecdotal information that we're all providing.
Which
So
I think is even more of a reason why it should be left up to the parents.
I think it should be left up to professionals. This is coming to us from medical professionals, epidemiologists at St. Luke's Health.
Just because people don't like what they're saying, it's very easy to say that information is wrong. It's very easy to.
What are the sources? Who were the peers that reviewed it? What were their sources? I'm just saying.
I don't, if we're gonna continue to quote the CDC, that's the same organization that also said, it's so bad, it's so terrible, and we have all these vaccines, we have all these boosters, we have masking, all the things we're supposed to save everything, I guess that's thrown out the window. And then, by the way, it's so bad with Omicron, we just reduced the quarantine period from 14 days to 5. That's illogical, it doesn't make sense. So I know we have to use the data set, but if the CDC is going to be quoted as God, maybe they should stop change the goal line whenever it suits which way the wind blows.
There you go.
Or maybe we should just stop making changes when we get better information. I guess that works too.
So
I don't know when that will happen.
So we have two options that have been proposed by the administration, and in my opinion, they are in ground zero. They are having to deal with both the contact tracing, they are also having to deal with the teacher shortage. So whether we like or don't like the cards we were dealt, this is what we have. We have a teacher shortage, which is even more compounded by the regulations that were laid out in front of us, by our own quarantine regulations. And then we have students. So Parents have options to have their children in masks, not have their children in masks. So we can argue on semantics or science or however we want to, who's right, who's wrong. What we have here is a plan, two plans put forth by the people who have to make sure our kids are safe, and we trust them to make sure our kids are safe every day, from snow days to late starts to early dismissals. So we trust that safety to them, and I'm just asking that we have two plans. Do I think they're perfect? No. Do I think this sucks? Yes. However, we have two plans, and it's the lesser of two evils. So what I would ask is if we could take action or a straw poll on option A and B, and if Andrew, if you would lay out option A and lay out option B, and we'll take a straw poll, and then we will go back and take a motion.
So, thank you, Mr. Wegman, and thanks for giving us the administration the credit to go through this. This is option A, which in your board packet is D1, current health and safety plan update. So the main crux of that plan is this outline right here, which is we would use the metric of the 5 cases on a 14-day rolling period to determine masks, okay? In high level, the option 2, D2, the alternate health and safety plan, removes that 5-case rolling average. There's no case count anymore, there's no metric, and it is just purely an optional process for masks. Both plans, just to be clear, do have the quarantining language in there and do have the test to stay program, which are listed in there, okay? That is what is in the 2 plans that are in front of you. So again, the major difference between current health and safety plan updated has a metric of 5 cases versus alternate health and safety plan, which has no case count at all. It's just purely optional. Does that make sense to everyone?
Okay. All right, so we will start with a straw poll on option A, which has the mask optional with the metric. So, Laura, yes or no? No. Liz?
Option 1 or 2?
No, just one.
So I'm in favor of an even tighter plan than the current plan, given the skyrocketing metrics, given St. Luke's recommendations, et cetera, So there is absolutely no way I could put any support behind a plan B that would expose all sorts of people, staff, students, family members to a really scary virus that frankly right now is out of control.
So you're no to both options?
Well, if my only choice is to support A, then I would support A over B, but I would, if we can get there, encourage us, for example, to at least with Plan A, add a level of restriction for visitors inside our building and ask them to please wear masks so that we're not bringing outsiders, sort of germs, if you will, into our buildings. There's something called the Dunning-Kruger effect. It's a type of cognitive bias where people with little expertise or ability assume they have superior expertise or ability, and that overestimation occurs as a result of the fact that they don't have enough knowledge to know that they don't have enough knowledge. And I would suggest that for me and perhaps others here, we are not medical professionals. We do not have enough knowledge to take the risk. Alexis, for example, that you're suggesting, which is, oh, let's try something that we haven't tried before because it might work. The chart on page 4, I think it is, shows that in an unmasked environment, the virus is spiraling out of control. Pediatric cases are higher than they've ever been.
No,
so
they're
I just
not.
can't get comfortable.
She is not doing her
A
research.
proposal that adds risk to our plan. So that's where I'm at.
Okay.
Thank you.
Mr. Hohenscheld, option A, yes or no?
No.
Mr. Stubitz?
Yes.
Mr. Hohen? And I'm a yes. So option B, which is just mask optional, with, still has the quarantining, just no, metrics. So, and we already know Liz is no.
Yes.
I'm a no.
Brian,
Oh, Brian, sorry. Option B?
Yeah, sorry, I was on mute. I am for option B.
Okay.
Did that come through?
Yep, you got it, you got it.
Thank you.
Ms. Stevens?
No.
Yes.
No.
After was a yes.
Correct.
Or you were yes, right? Matt?
Option B.
Yeah.
So then, we need a motion and a second to adopt option. So then we would need an amendment for, the motion and the second for option B.
motion.
If you don't have an amendment, then you're voting on it, and once you vote on the original, it needs to be turned down, and then you have the motion to be made to new,
All it says here, it says 1 and 2 to reauthorize.
Yeah, they're both on there, so.
You have to select one. All right, so then we'll continue on and, okay, go back to,
So what's that here?
so we're gonna continue on with the agenda. We're going to make a roll call vote. And then we have to go back and get a motion and a second to adjust the
So
time.
the roll call is voting for number 1.
current.
The current line.
Correct. If you go with the current motion, it's to maintain the current health plan. So since you're voting on a block of things, if you are approving one part of it, you have to vote no, and then a motion would have to be made to.
So we have to
make the
pull
adjustment.
out D.
We'd have to get.
Or amend.
We have to get an amended motion, and Mr. Sheets said he is not willing to amend, so that's why I said
Will
we have
you
to go
amend
through
to
this.
vote for item D separately? Item D separately? There's a stubborn part of me that wants you to tell me to go somewhere, but I guess that's fine.
So the motion then is to remove D and vote on that separately.
Correct.
Second.
I'm sorry, I couldn't hear the motion.
So the motion was to amend the original motion, which pulls out letter D from the voting of the other items on this portion of the agenda. So what we are going to, after committee reports, we're going to vote on everything except for item D.
So D is non-existent?
Nope.
It's being pulled
It's
and
fully pulled and voted on
after.
2 votes.
So we're gonna vote on all the items with the exception of D. And then we're gonna vote on.
We're gonna vote on item 1 and vote on item 2. Is that right?
No. We're removing option, letter D completely from this motion. Completely. We're gonna vote on everything except for D. And then we're gonna need a motion and a second to vote on item D separately. After.
Because we didn't amend it, so we would be voting on the current health and safety plan, yes or no. As it is right now, which was option 1.
Okay. What about option 2?
We have to
That's
either
what we need.
approve it, yes, or not approve it, no, and then we will have to
Someone's going to have to make, once you vote on, if you look at the agenda, the motion right now on the table in second is that you are going to vote on item I, Board of Directors Report A, B,
C, and the committee reports. Once those votes are completed, someone then will then need to make a motion for a vote in regards to D, whether it be 1 or 2. Because that's going to be voted on separately outside of this portion of the agenda.
I guess what I'm asking is there going to be an option to vote on 1 separately?
Depends on who makes the motion, Mr. Hefner.
So we'll cross that bridge once we get.
Okay.
So make the motion.
Okay.
Make the motion for D2. Just make the motion to approve D2.
When you get to
When we get to that point.
Okay.
First, we're gonna roll through committee reports here. All right, committee reports. Mrs. Hume, BCIU.
There was no BCIU Board of Directors meeting in the month of December. That's kind of standard practice. The next Board of Directors meeting is coming up on Thursday, January 17th. That concludes my report for now.
Thank you. Mr. Sheets, BCTC.
I was unable to attend the December meeting. The next BCTC meeting will be on January 26th at the East Campus. That concludes my report.
Ms. Delberico, BEITC.
Yeah, so the tax collection committee met on December 16th via Zoom. Some notable items that we went over, the new tax software, through some financial reports to the end of 2021. We also approved the operating budget for 2022, and also approved their auditors for the next 3 years. They also elected officers for the upcoming year and also elected tax appeal board members. And that concludes my report.
Thank you. Cola, Mr. Walliser.
So the Pennsylvania school funding case is still going on in Commonwealth Court. It's been pretty interesting to watch there's been a lot of different superintendents throughout the state of Pennsylvania that have been testifying. How the evidence is clear that our schools need more funding to operate effectively. And when our state is failing to fund our education system, it puts unfair responsibility on our local taxpayers. It's been shown that 277 of the PA schools need more than $2,000 per student just to provide the daily adequate supports for classroom instruction. And in the long run, the state would only have to spend an additional $4.6 million to make up for that downfall. So it's been very fascinating to watch, and I'm looking forward to seeing what this outcome will be, because it could definitely be monumental for our Pennsylvania schools, public schools. And our next meeting is.
Excuse me, before we go any further, may I interrupt you?
Yeah, sure.
I'm wondering if you're familiar with Senate Bill 471 in session of 2021, amended as recently as November the 8th, 2021.
Off the top of my head, I do not know what that one would be.
Okay, well, I think it may have some impact on the employment, some of the people employed here. Are you familiar with this?
Yes.
Huh?
Yes.
Would you like to explain it?
No, go ahead.
I think it basically, without reading the whole thing here, it's been amended, like I said, November the 28th, 2021. It has to do with prohibiting mandatory COVID-19 vaccination of Pennsylvania residents by the Commonwealth political subdivision or as a condition of employment. It goes on in here and gives you some specific things here. Citizen may not be forced to sign a vaccination declination waiver. And basically what it does is if you get laid off because of any reason there, you can collect unemployment, which some businesses are allowing it to be done. So I think it goes far to protect the rights of everybody in the Commonwealth. If anybody is interested, I can have the secretary make copies. Doesn't matter. I'll give you one now. What I'm getting at is, you have to review with everybody, if anybody, we get a majority vote on this, I think it'd be appropriate if we agree with that particular Senate bill that we ask our solicitor to draft a resolution in favor of that, and we could forward that on to all our representatives from the district. Thank you.
The next COLA meeting is February 8th at 7:30, and the presentation will be from the Pennsylvania School of Business. Andrew, I don't know if you have anything else to add.
Nope, that was perfect.
Okay.
You got all the big points, and that lawsuit's a key one.
The PARS organization, which is Pennsylvania Rural Small Schools, which as a school district we belong to, are one of the key players in that lawsuit. So hopefully we'll find some equity and funding that after it all comes out.
All right, you still have the floor there, Ms. Walleiser, for policy committee.
Oh, this is a new seat for me, so I have nothing new to report.
Understood. Strategic planning and goals, Mrs. Eisenhardt.
And Mr. Coniger presented on December 10th the district strategic planning goals to the entire community. And what I have to say, I thought it was very well put together and it was very well received by the community. I got lots of people who watched. But,
Oh yeah, good.
That said, they were, I mean, some of the stuff that everyone like doesn't love to hear, you know, some of our harder points, but at least they said it was very, you know, transparent and some of that stuff, and you know, they were tracking it. So I think that's.
You appreciated your honesty.
Yeah, it's something to be proud of because you know, while it's not always fun to say some of the stuff that we're not great at, we're recognized.
It's great feedback. Thank you very much for that. Yeah, it was a new format for us, and so it's good to hear that feedback of what we can do in the future.
Yeah, I mean, it's nice that we can stream these things now. That's one of the benefits of all this is the amount that we're getting out there. But you know, hopefully the next time we do it, we have a bigger crowd.
All right, Mr. Sheets, negotiation and compensation committee.
Nothing to report. I feel bad because I was having some health issues last month. That's why I wasn't able to stay for the entire meeting and missed a bunch of other stuff. So I am going to be reaching out to the committee members though within the next week to try to set something up either at the end of January, beginning of February to kind of catch up on where we're at and move forward. I think it was more important.
Thank you. In building and construction committee, I know we have a presentation.
Bear with me 1 second. I'm working on getting them in the presentation. So the presentation this evening is from our ESCO company, Provident Energy. They are going to be doing a presentation on what the ESCO project is, as well as when we look at ESCO, where we are so far. We've done a lot of work behind the scenes in November, December, and then what the next steps are. So there's no approval this tonight. It's really more of an update. And so Mr. John Young will be joining us. And we have him on this evening right now. So I'm going to present my screen right now. And we'll be able to get started here.
I've got it.
You're going?
Yep.
Okay. So again, the idea and concept here is we wanted to provide you an overview of what an ESCO is, knowing this is the third phase of our building project. We have decided to go a little bit of a different approach, and an ESCO is a way to capitalize on savings that are connected to some kind of energy savings related to district projects. And so that's what we're going to be working on here. And Mr. John Young has really been our key leader for that. And so he's going to be the one that's going to be talking to us about what an ESCO is and what we've done to get here and what are some of the next steps. Okay. John, thanks for joining us this evening.
Briefly, I'm John Young from Provident. Also on the call from Provident, we have Joe Solomon. ICS is our partner firm. They are a large engineering and consulting firm that has a lot of technical heft to preparation of the RFP, the analysis, and the recommendation. I just ask for a hand here if you can see my screen.
Yes, we can.
Great, thank you very much. I know Andrew has done a great job of prepping most of these folks with the background on the GISA, but just as a little bit more background, the Guaranteed Energy Savings Act has been around since the 90s. It's been updated a handful of times, expanded, most recently with Act 163 of 2016. It's really a procurement vehicle that's focused around the energy and infrastructure needs of governmental buildings, distribution measures, and facility improvement measures are the key implementations. An energy conservation measure could be thought of as interior light. That's the most classic one, where you go from a legacy technology like fluorescent bulbs to LED. You have a reduction in usage, and it crosses over to the facility improvement because you have an improved learning environment. And of course, that's why we're here, right? To provide a location for a suitable environment. The facility improvement measures will be more things like chillers, air conditioning, things that may not be saving you a great deal of money, but again, are enhancing that school environment. So ECMs and FIMs, big terms when we talk about these ESCOs. The performance contracting portion of it really revolves around there's a guarantee, right? So these ESCOs come in and they're going to provide guaranteed savings of energy that will offset the cost of the implementation, right? So that's all part of the process. The design build process of PISA means that the ESCO really becomes your partner in implementation. So you get to have one point of contact for all your different trades. So if there's a problem with something, it's their responsibility to resolve it. There's not as much infighting because they have to, as an ESCO, ensure this all gets taken care of. The PISA process does not subject schools to the traditional procurement sole low bid is the sole determining factor. We can do a lot more qualitative analysis. We can look at their teams, we can look at their implementations, we can look at their history, ask them a lot of questions, and make a decision on what's the best fit for the district. I mentioned before about ICS being our partner. There was a lot of background here preparing the different ECM and FIMs that the ESCOs were to look at, and then they give their own spin on. So that proposal, when we get back, we're going to look at their proposals in the process of doing now and make that qualitative analysis along with the technical or financial analysis with the district to come out with the best answer. At the end of the day, that shows ESCO has to guarantee that the technical, that is the actual implementation, meets the objectives that we've determined they should, right? And also that it's done at that fixed cost and there's no change orders, right? So if they say we're adding high school, we're adding, like the 2016 project where we added cooling to the elementary school. If they say they're going to add cooling in such a fashion, they have to implement that for those costs. The only way there would be a change order would be if you agreed to some efficiency that you saw you wanted to add on. Because during their analysis, they say, hey, you can do this as well. There's an opportunity for some sub-piece to be changed and upgraded. Then you could say, hey, we really want to do that. But otherwise, they have to do it for what they say they're going to do it for. So it's a little bit of a different approach. I can be more expansive on it at a future time. I know that it's been a long evening so far, so I'll move forward to give you an idea on the background of where we are. Of course, we were here this summer to talk about starting this process. There was a lot of work done with the district in producing that RFP with those ECMs and FIMs. There was about a 5-week window after that where the ESCOs came and visited facilities, and Mike and Andrew and Nicole were very helpful in allowing that access towards school, finding the windows when the school was closed, to get all these folks in that have to go in and count lights and look at the different HVAC equipment in the building envelope and do their measurements so they can come back and give us a proposal. Those proposals came back, if you look here, on the 17th, this is when they were due to receive proposals from 3 great ESCOs. Efficiency Network, known as 10, Garrett, which is a big company out of Ohio, and our ESCO has a local presence in the area as well. So those 3 came back just before Christmas. There was a lot of analysis done in consultation with Andrew, Nicole, and Mike over the Christmas break. We issued the first set of requests for information back to these ESCOs to kind of dive into some of the responses and get more of the information that we're looking for to make our analysis. We asked them for a lot of information. We actually extended the window for those responses to come back until tomorrow. So that RFI number 1 that was individualized to specific ESCOs, that's coming back tomorrow. And then a week later, on the 18th, we we are scheduling the individual ESCO interviews, which will be done remotely, and that'll allow us to, hear what their story is, how they feel about the district's needs, how they plan on meeting the needs of the district, what their plan is, what their plan is, an opportunity for them to sell us on their product, and for us to be able to ask them questions and further refine our understanding of what they're trying to do. Subsequent to that, there's going to be more requests for information, more analysis by the team, including the administration there, Providence, and ICS, and we come back to you at your board meeting on the 7th of February and propose to move forward with the selected and recommended ESCO towards really the second part of this, which is going to be them coming in and doing an investment grade audit, really refining their proposal numbers, our chance to refine the scope. And we asked them for a great deal of information. We asked the ESCOs to look at about 18 or 19 different ECM FIMs that cross a lot of categories in the district. So we're going to have to look at that and say what makes sense for the district to keep in as part of this project. And then eventually we would come back and have a package at some future date, March or April, where we'd say, hey, this is the package, this is the implementation, this is the cost, and this is the timeline. And we would get us for the board's approval at that time. And then we would get the notice to proceed and conceivably get a lot of this work done next summer and into fall. Of course, it's always done with the educational environment at the forefront of thought, right? So we're not going to compromise with guys putting so many efforts for the administration and the staff putting efforts into. We're always going to have these guys working around your schedules as they implement. So that's a big part of communication. That's a big part of the process. Again, I can continue for an hour to talk through this all, but I just wanted to give you a kind of a brief update and let you know where we were at.
John, thank you very much. That's a perfect overview. It gives the board hopefully an understanding of what an ESCO is. The reason why we decided to go this direction because of the energy savings to help offset the cost. The no change orders obviously is a very alluring aspect to this process as well. And then some of the timeline and processes, as was just outlined, where we put the project together, we've engaged in companies, they've given us their proposals, we've asked for more information to get a little bit more detailed. And the difference between this and a regular project, you have to have everything outlined down to the T of the color of the outline. Right now, we're just saying, here's our idea, and that's where we go back and forth with this company to come up with a refined, here's exactly the scope once we pick the company that we really want. So the first part is, here's generally our idea. The company gives us their opinions or their proposals of what that could look like. We find a company that seems the best fit with who we want to partner with, and then we can refine that scope a little bit further, exactly, down to the color of the atlas type thing. So right now we're in the phase of who's that partner we want to be with long term. So any questions for John before we conclude here? I asked him to keep to about 5 minutes. You were right on. Good job, John. Thank you.
Great to hear on you. Thanks for your time.
And Joe, thanks for joining us as well.
Not a problem. Good to talk to you again.
All right. So again, we just wanted to provide an update. No voting items at this point, but just so you can see the timeline. The next meeting is January, I think it was 18th, when the building construction committee will get together for those virtual interviews with those companies to help better define who that partner is going to be that we're going to be working forward with. There'll be some more details, more exploration, and then hopefully at the next meeting, we can come back to you with a company. Mr. Weichman, I'll turn it over to you.
All right, any other board discussion on any of the items other than item D? Hearing none, can I get a roll call, please?
Mrs. Eisenhardt?
This is for A through C in the committee reports. Yeah.
Correct.
Mr. Huffman?
Yes.
Mr. Hohenschultz?
Yeah.
Mrs. Hume?
Yes.
Mr. Reitauer?
Yes.
Mr. Sheets?
Yes.
Mr. Stubitz?
Yes.
Swalweiser?
Yes.
Mr. Wagner?
Yes.
9 yeas, motion passes.
All right, now moving back to letter D, to amend the health and safety plan based on option 2, which was mask optional with no building metrics. Could I get a motion and a second?
So moved.
Second.
All right, the one thing I would just like to say before we take a vote, and I will open up to any further discussion, is that I have grave concerns, several grave concerns. One is for the health and safety of the students. Second is for our staff and for our administration. The amount of time that I believe this second plan will cause them to have to put into contact tracing that is an already taxed burden for them. We just heard Mr. Dinich is covering classes, Mrs. Kelly, Mr. Farino, they're all doing their part to chip in here. And by doing this option, in my opinion, I think we're going to tax them even further. And I would hate to lose any one of our administrative team over something like this, because I think we take that risk. You never know, that could be any option, but I have grave concerns about this. Furthermore, with this option, I believe we're probably going to have to seek an outsourced company to do contact tracing, which will cost us
$30.92. It's already on
an hour.
Right. Okay.
Which is equivalent about.
But that takes the burden away from our administrators, does it not?
It'll be up to 40 hours a week.
Okay. Up to you, sir.
That's what they're
So it
currently
could be
spending.
anything from 1 to 40, but not necessarily always 40. No benefits.
It's an outsourced.
It's an outsourced hourly wage.
So that is on the agenda.
Okay.
The other piece that I would, if we're gonna go this direction, do the test to stay, would like to, I'll investigate and come back with some options for maybe some kind of contract and nursing piece, because currently we are a nurse, we are down a nurse, and so to implement the test to stay would be a little bit more for the burden. So
Are they tests that have to be administered by a nurse?
yes,
Not like a
that's
swab, like a home swab?
my understanding. You have to have a nurse. Well, I'll
I've
investigate.
read just from other districts, and just reading pieces of other districts, that they get exposed, they get sent home with the test. And they take them home and.
No, with this
This is in New York.
district program that we have to do that in school. There's separate protocols of reporting back to the state and yada yada.
Yeah.
Any other points of discussion?
Mr. Wagman,
Yes.
2 considerations I asked my colleagues to evaluate. One, given the direction it appears to be headed, is there any appetite among my colleagues for implementing a slight edit in that second plan that would require masks for visitors in our buildings? That doesn't impinge on parental choice. It doesn't require our administrators to do very much at all beyond what they're already doing. But it would possibly, if you believe even slightly that masks help minimize the spread of germs, and acknowledging that our custodial staff is incomplete, and so our cleaning protocols, again, despite valiant efforts, are probably not up to snuff. Could we at least consider requiring strangers, if you will, quote unquote, visitors in our buildings to mask up?
Liz, I hear what you're saying, but it would probably be next to impossible to police outside of the day-to-day. As far as sporting events, I have attended several, and next to impossible, it's not respected. So when that announcement is made, they choose not to do it. And I just don't know that we have the manpower to make sure that is accomplished, that it's not during the school day.
Yeah, I was thinking, frankly, in terms of the school day. So, people have to come through our main offices, and go through their Raptor system or whatever to identify themselves, and we could check masks, during the school day. To your point about athletic events, we have ticket takers at many events. They could at least attempt to suggest that, spectators require masks or wear masks.
Is there any appetite for making that change?
No.
Might I ask what the rationale is? If our goal is to try and keep our kids in school and to enable parental choice, how does requiring a visitor impinge on either of those concerns that you've expressed? I'm just trying to understand the logic thinking around rejecting that thought process.
It's definitely a valid question. I also have the same concerns as far as choice. You're taking the choice away from parents who have choose to have their children wear masks because they now have to quarantine so you are removing some choice from the other parents. So there's
What's the difference between removing it from the child who's not wearing it? It's not removing it from the parent. If you want to wear a mask, then wear a mask.
correct, but I'm saying the choice to quarantine. So in this option, okay, your child is not wearing a mask and my child is. Your child tests positive, he has to quarantine. Therefore, you took the option away from my child to be in school.
No, because if you're vaccinated, you don't have to quarantine, and if you do the test to stay, you don't have
Well, we
to
just heard that
quarantine.
vaccines they don't work, and the vaccines are not healthy for students.
And you just
So,
test, you don't have to
Didn't we establish that the test is going to take day 0 doesn't count, day 1 and 2, so possibly 2, if not 3 days?
No, they're in school. They don't have to stay out of school. They said that maybe days 0 and 1, they're still in school because it hasn't been identified yet.
But isn't that dangerous? I mean, if you think that a child might possibly have the virus, to keep them in school knowing that, is that not somewhat reckless?
This is I guess in my opinion, this is the way I feel in my decision. I guess.
I think we could talk about this for hours. And
Yeah,
we're not gonna all agree, so I think we need to move on to what's on the table here for us to vote on. We're not gonna change anybody's
Something
opinion.
on the table, I'm just looking for yay or nay. Is there any support for adding?
But I gave you my answer, and then you didn't. I gave you my answer, and you wanted me to explain it. You said you just asked for a yay or nay.
it doesn't appear there is, Liz, so,
I can't see, guys. I see 3 people, and only one of them is a voting member, so I don't need to push. I'm just trying to understand. My second thought for folks to consider would be, given that we're testing a new concept here, and potentially absorbing some significant risk, would there be any appetite for the administration and the board to suggest that we revisit with some data and results, either bi-weekly or, dare I say weekly? I'm concerned that if I say weekly, that would be a burdensome request, but perhaps bi-weekly. As an example, I think Schuylkill Valley board took a direction, but then promised to revisit it on a very regular basis as they continue to monitor case counts and results and student absences and staff absences, etc. Is there any appetite among my colleagues to ask for a regular update and the opportunity to revisit this without having to call an emergency board meeting?
Well, Andrew does provide the daily and weekly updates as far as the cases, so that point, or that part, I think, is probably satisfied with what he is currently doing. As far as revisiting, that is an option at any time. Any board member could ask that be added to an agenda at any time, so.
Okay, thank you.
So, any other comments? Hearing none, we get a roll call vote for option 2, which is mask optional with no case matrix.
Mr. Hefner?
Yes.
Mr. Hohenschel?
Yes.
Yes.
Mrs. Hume?
No.
Mr. Rightower?
No.
Mr. Sheets?
No.
Mr. Stevens?
Yes.
Mrs. Wallheiser?
Yes.
Mrs. Eisner?
Yes.
Mr. Wagner?
No.
5 yeas, 4 nays, motion passes.
All right, moving on to business and operations report. Can I get a motion and a second?
So moved. Ms. Reagan, I need to step up.
So good evening. So attached to the business operations report, we'll start with sections items A through D are to approve the bills list. Item A is general fund through $3,579,240.72. Item B is approved food services fund bills for a total of $26,973.59. Item C is to approve the construction fund bills for $444,675.67. Item D is 0. So item E, items 1 through 5 are to approve the financial reports through November 30th. As they are attached, items 6 and 7, there are no reports for this month. So item F, items 1 and 2, item 1 is to approve a 2-year agreement with Concern out of Fleetwood, PA to provide student support services as attached. And item 2, similar, providing student services, behavioral health from Salisbury Behavioral Health out of Reading, PA. That is also a 2-year agreement. Item G, there are none. Item H, this goes back to our recruitment retention. Item 1 is to ratify addendum number 2 with SOS to increase the pay rate starting at $13 an hour. Well, I should say up to $13 an hour for contracted custodial services as attached.
Let me just make a note there. That was one of the things we presented back in December. And after we presented that, we let SOS know. To date, we've had no new substitutes or no new custodians. So just wanted to make sure the board was aware that that increase that we did has not yielded any results. We're still going to comply with custodial support.
And then we have one change order on the agenda this evening, and this was with Grace Construction. This is the second half of the invoicing for the abatement work that was previously done at a cost of $9,634.87. Item I, this is part of the whole budgetary process, kind of outlining the community night. This is a resolution not to exceed the actual index of 4.1% for the 2022-23 fiscal year. This is basically saying that we could not increase taxes by more than 4.1%, which, if you look historically, we have not even been close to that number. And we would also have to apply for exceptions, and there's special criteria that is grandfathered in that we perhaps would not be approved for. So item J, this goes back to Bo, who presented earlier, and I handed out hard copies. This is to accept the 2021 single audit report as prepared by the district's external auditors, Foreman and Associates. They presented without any material weaknesses, significant deficiencies, or control deficiencies. The next one, I believe there's an adjustment in the meeting minutes. This evening, we are approving Angela Tyson as a tax collector for District Township, effective January 1, 2022. You'll see that there is technically nobody resigning, as Suzanne Davis was doing it. She was not elected. She was simply doing it in addition to Topton Borough. And item L, this is an agreement, in the case that we would need it with the American Red Cross to permit them to use our facilities in an emergency situation. For a length not disclosed, which shall end 30 days after written notice as attached. Similar to SOS, this is item M, is to ratify an addendum with STS to increase the substitute pay rate based on the filing schedule. This goes back to increasing the rate from 100 to 130 a day and from 110 to 150 a day. And that was also reflected in the prior board meeting minutes that was approved earlier this evening. And lastly, item N, to approve an agreement with Cook County Wellness Services for contracted contact tracer position at a rate of approximately $30.92 per hour for up to 40 hours per week as attached. Does anyone have any questions?
Mr. Wagman, I have just a couple of quick questions on item M. Mr. Pottinger, just like you gave us a quick update a minute ago about those other, the custodian positions where we raised wages, is there any status update on the impact in the past 20 days or so for substitute teachers?
Mrs. Hughes, I don't have any data points to share with you this evening. I can share that we have attracted some new substitutes. The precise number I don't have, but it has worked in terms of over the winter break, we were able to pick up a few extras.
Terrific, that's great news. Thank you for sharing. And then on item N, just a little bit ago, I think we were discussing this. So if I understand correctly, we go to this company, Cook County Wellness. They hire someone from a temp agency. We get charged just shy of $31 an hour for up to 40 hours a week to offload work that our administrative team and nurses are currently handling. Is that correct?
That's correct.
And is this being funded by Brandywine taxpayers, or
Yes.
is this being funded by grants, COVID-related grants?
It would come out of the general budget.
Say it again, please.
It would come out of the general budget.
Which means it's being funded by Brandywine taxpayers.
Correct.
Are there no COVID-related funds for something of this nature?
There would be that grant application has been submitted, and this was not part of that grant application.
Oh, so we can't read it. Switch pods, so to speak. Okay.
Right.
All right. Thank you. Again, it's unfortunate that I think we just approved a plan that may drive the level of work related to this high. Do we know that one contact tracer is sufficient? Is it possible we'll need more?
So I don't know that, and honestly, time's going to tell. And also, hopefully, when we look at the data charts, the number of illnesses start to fall off in the next 4 to 6 weeks, and that's really the goal here. But right now, that this position is, even without changing plans, is desperately needed.
Right. Well, that's what I was thinking. Without changing plans, you haven't recommended it. With changing plans and an acknowledgement that this level of task may get higher, that's why I asked the question, is one enough? And finally, on the contract, it says it's a 12-month contract, but I just want to confirm that we can terminate at any time if we determine that the need is no longer there, correct?
Yeah, my computer died at the moment, but if you look at the current length of the contract, the term expires at the end of the school year. And we also wrote in that it could be disbanded if the need's no longer there. So if all the COVID cases go away and it can be handled by the nurses, we can eliminate this contract at that time as well.
Great, thank you.
Yeah.
Yeah, roll call, please.
Mr. Hohenschel?
Yes.
Mrs. Hughes?
Yes.
Mr. Reithammer?
Yes.
Mr. Stevens?
Yes.
Mrs. Eisenman?
Yes.
Mr. Hefner?
Yes.
Mr. Wagner?
Yes.
7 yeas, motion passes.
All right, can I get a motion and a second for the superintendent's report?
So move.
Okay.
So there's only one item on the agenda this evening, and that is for the approval of an Act 80 Day. What an Act 80 Day does is
there's 180 days that are required in the school year. That's the school code. And so to be able to do that, there's certain circumstances, like the one that's in here, where our students, we lock into graduation, we use Queensland University. The only time they could give us is before our official end of the school year. So we're 2 days short. So you can use professional development days to make up for that 180-day complementary of days you need for the rules of the school code. There's two rules. You have to have 180 days or 900 hours of instruction for elementary, 990 hours for secondary. So you can't ever bypass the hour rule, but you can bypass the day rule. And so we will be able to still meet the instructional hours without these 2 days, and we'll be able to, by you approving this tonight, which is required, we can submit the application and then have the academic days count as 2 instructional days for those seniors. The other thing, just anecdotally to note, I think everyone knows, but Friday was our first virtual snow day. It went very well from the administrative lens of it, from the teacher side of it. They did a phenomenal job of being ready for that. Our attendance was really good. Average district-wide was 91%. That for me was a really good day. So just as a reminder, we're going to continue with virtual snow days on days like Friday, not significant. We'll do the full day on days when it's more significant. I kind of have like 6 inches in my head. We'll do a half day virtual, so that way we can kind of buffer that, knowing that there's a lot more work for some of our older kids and some of our younger kids will go out and play. So we'll buffer that. Teachers and staff will be available if a student would need something. That there can be time set up to be working with students if needed in the afternoons. But there won't be set classes on those significant snow days. And then likewise, it gives our staff that maybe have ordinances that have to have driveways or walkways cleaned at a certain time, that ability to go out and do that in their breaks. Okay.
You want to add to your report the implementation?
Oh, thank you. Yeah. So I just leaned over to Mr. Wagner. What we did approve earlier under item D was an implementation plan timeline for what we approved tonight for the mask optional. So what I'd like to propose, if this is okay with everyone, is I don't want to send a message out tonight. So if I can craft that message and send it out, and then we can implement it Wednesday, I appreciate just that day buffer to be able to plan and execute the implementation. Is everyone okay with that? You okay with that? Tomorrow we just state status, and then Wednesday that would change back. Okay. Mr. Hefner, you're okay with that?
Yes.
Thank you for that latitude.
Any other board discussion on those items? Hearing none, can I get a roll call, please?
Mrs. Hughes?
Yes.
Mr. Reitauer?
Yes.
Mr. Sheets?
Yes.
Mr. Stevens?
Yes.
Mrs. Eisenhardt?
Yes.
Mr. Hefner?
Yes.
Mr. Hohenschel?
Yes.
Mr. Wagner?
Yes.
8 yeas, motion passes.
Thank you. Personnel report, can I get a motion and a second?
So moved. Sheets. Second.
Motion and a second.
The items that are in front of you in the personnel report, just for sake of time, if everyone's okay with that, I'd like to just say that the personnel items are as presented. There's no changes. If someone does have a specific question, I can answer that. But again, for sake of time, I thought I'd just do what's in front of you has not changed. Any explanation of any items needed?
Any questions? Get a roll call, please?
Mr. Reitauer?
Yes.
Mr. Sheets?
Yes.
Mr. Stevens?
Yes.
Mrs. Eisenhardt?
Yes.
Mr. Hefner?
Yes.
Mr. Hohenschel?
Yes.
Mrs. Hughes?
Yes.
Mr. Wagner?
Yes.
8 yeas, motion passes.
Is there any additional public comments? All right, any additional board discussion? Before adjournment, I must announce that we did have an executive session for board training. Hearing no other discussion, could I get a motion and a second to adjourn?
So moved. Sheets.
Thank you, everyone.
Thank you, everyone.